Yang itu kayaknya udah ada. Malaysia kayaknya udah ada.
Good morning, ladies and gentlemen. Welcome to the 5th International Nursing Conference. Treatment of children with cancer in the COVID-19 pandemic era.
Selamat pagi Bapak, Ibu, dan Saudara sekalian. Selamat datang dalam seminar keperawatan internasional yang kelima dengan topik perawatan anak dengan kanker di era pandemi COVID-19.
International Nursing Conference is a collaboration of 4 nursing diploma in Jakarta, Indonesia, namely the Keris Husada, Pelni Jakarta, Pasar Rebo, and Council of Churches in Indonesia, Cikini.
Seminar internasional keperawatan ini adalah kerjasama dari 4 akper, yaitu Akper Keris Husada, Akper Pelni Jakarta, Akper Pasar Rebo, dan Akper Persekutuan Gereja-Gereja Indonesia Cikini.
I'm Susiana Johnson. I'm pediatric nursing lecturer in Nursing Academy of Pelni, Jakarta. I feel honored to be your MC today. I will lead this conference in English.
Dan saya, Farida Purnamasari. Saya adalah dosen medikal bedah dari Akper Keris Husada Jakarta. Saya merasa terhormat dapat menjadi MC pada hari ini. Dan saya akan memimpin jalannya acara seminar ini dalam bahasa Indonesia.
First of all, let us say thanks to God Almighty, who has given us this occasion to hold the International Nursing Conference.
Pertama-tama, marilah kita bersyukur kepada Tuhan Yang Maha Esa, karena telah dapat diberikan kesempatan untuk mengikuti seminar internasional keperawatan ini.
Before we continue with our agenda, we are going to show you a list of the rules for our conference today.
Sebelum kita memulai acara, berikut tata tertib acara kita pada hari ini.
First, after joining Zoom meeting, please switch off your microphone and switch on your camera. During the presentation, the host and co-host will have complete control over the audio or speaker.
Setelah masuk ke dalam aplikasi Zoom, mohon setiap peserta agar menonaktifkan suara atau mode mute, namun tetap mengaktifkan kamera. Dan saat presentasi berlangsung, kontrol suara sepenuhnya akan dipegang oleh host dan co-host.
Second, please write your ID using your full name and not the name of your device.
Semua peserta diwajibkan untuk menuliskan nama asli pada aplikasi Zoom dan dimohon tidak menggunakan nama perangkatnya.
Third, if you have any question, you may ask your question using Zoom chat room or YouTube, and don't forget to also write down your name along with your institution name.
Pertanyaan bisa diajukan melalui chat room Zoom atau YouTube dengan tetap menuliskan nama dan asal institusi.
Fourth, the certificate will be given to those who have already registered and fill in the evaluation link.
Sertifikat akan diberikan kepada peserta yang telah melakukan registrasi dan
join in Zoom application. Please see in live streaming YouTube. The link is on your screen.
Apabila Anda tidak dapat mengikuti di aplikasi Zoom, maka Anda dapat menyimak melalui live streaming YouTube dengan menggunakan link yang tertera pada layar Anda masing-masing.
Six, we hope all participants to be able to take part in the seminar until it's finished and without any disturbance.
Semua peserta diharapkan agar dapat mengikuti kegiatan webinar hingga selesai dan tertib.
In this moment, I would like to welcome the honorable guest, participant, presenter, and also the respectable Auctoria Potoman, RN PhD from Thailand.
Profesor Dr. Farida Maut Said from Malaysia.
Dr. Alide Kania, Bachelor of Nursing, Master of Science from Indonesia.
Profesor Dr. A. Jayasuda, Master of Science, PhD, RN RM from India.
Nusrohman Azam, Bachelor of Nursing, Master of Nursing, Medical Surgery Nurse, Specialist, Representative, the Chief of Indonesian National Nurses Association.
Mrs. Yupi Supartini, Bachelor of Nursing, Master of Science, the Chief of Educational Nursing Vocational Institution of Indonesian Association.
Mrs. Silvana Evelinda, Master of Nursing, the Chief of Regional Tour of Educational Nursing Vocation Institution of Indonesian Association.
Nurse Tati Setiarini, Master of Public Health, Director of Nursing Academy of Keris Husada.
Mrs. Buntar Handayani, Master of Nursing, Master of Management, Director of Nursing Academy of Pelni, Jakarta.
Nurse Iga Dewi Purnamawati, Master of Nursing, Pediatric Nursing Specialist, Director of Nursing Academy of Pasar Rebo.
Nurse Yeni, Master of Nursing, Medical Surgery Nurse Specialist, Director of Nursing Academy of Council of Churches in Indonesia, Cikini. Ladies and gentlemen, please give appreciate to all of us and especially to our speakers today.
Para hadirin sekalian, mari kita berikan apresiasi kepada kita semua dan para pembicara kita.
Thank you. As we are about to begin, please be seated and kindly switch off your microphone and Zoom to avoid interruption.
Kita akan memulai acara kita. Diharapkan kepada semua peserta untuk duduk dan menonaktifkan mikrofon atau suara di Zoom untuk menghindari gangguan.
Ladies and gentlemen, on this conference, let me inform you the structures of the agenda today. First, opening ceremony. There are performance dance, pray, national anthem, followed with Mars Indonesian National Nurses Association, welcoming speech and opening from the Chief of the Seminar Committee, welcoming speech from the Chief of Indonesian National Nurses Association, welcoming speech from the Chief of Educational Nursing Vocational Institution of Indonesian Association. Second, conference session. Third, discussion session. Fourth, oral presentation. Fifth, discussion session. And the last is the closing ceremony. Now, before we start the main agenda, we will watch the video of performance traditional dance, Nusantara dance, which is compilation of Sundanese, Bataknese, Batavian, Papua, and Balinese culture.
Sebelum kita memulai acara, marilah kita nikmati bersama tarian persembahan, tarian Nusantara, kompilasi dari daerah Sunda, Batak, Betawi, Papua, dan daerah Bali.
Mesat ngepung luhur jauh di awang-awang, beber kelejang jangna, bangun tayak karingrang, sukunya ranggowas, rejeng pamatuk menyuluh, ngapak mega bari hiberna tarik nuru. Saha anu bisa nyusulkan tandangna, gandang jeung pertentang payah bandingan mana, dipika gelut
keke, samuna muna muna keke. Kusa ride, kusa say, ride, 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 ride. Kusa ride, kusa say, ride, 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 ride. Yunako, nikinye, yasore, yasasore, yeah, yeah.
She tells him, ooh, love, no one's ever gonna hurt you, love. I'm gonna give you all of my love. Nobody matters like you.
Stay up there,
She
stay up
tells him
there.
your life ain't gonna be nothing like my life. You're gonna grow and have a good life. I'm gonna do what I got to do. Yeah. So rock-a-bye, baby, rock-a-bye.
Rock-a-bye, rock-a, rock-a, rock-a-bye.
You rock-a-bye, baby, don't you cry.
Rock-a-bye, rock-a, rock-a, rock-a-bye.
You rock-a-bye, baby, rock-a-bye.
Rock-a-bye, rock-a, rock-a, rock-a-bye.
You rock-a-bye, baby, don't you cry.
With a bang, bang, bang. Alright then. Rock-a-bye, down by the cry. Lift up your head, lift it up to the sky, yo. Rock-a-bye, down by the cry. Angels around you, just joy your eye car. Rock-a-bye, down by the cry. Lift up your head, lift it up to the sky, yo. Rock-a-bye, down by the cry. Angels around you, just joy your eye.
Beautiful Nusantara dance videos as beautiful Indonesia with this diversity.
Sungguh-sungguh tarian Nusantara yang indah, seindah Indonesia dengan keanekaragamannya.
Ladies and gentlemen, let us start this seminar by praying first. So, the event on this day will run well without any obstacle. Prayer will be led by Mr. Sumrahadi, Master of Public Health in Islam.
Baiklah, hadirin yang saya hormati. Marilah bersama kita tundukkan kepala menurut agama dan kepercayaan masing-masing untuk doa bersama agar acara pada hari ini dapat berjalan dengan lancar. Doa ini akan dipimpin secara agama Islam. Saya persilakan kepada Bapak Sumrahadi, MKM.
Thank you, Master of Ceremony, for having me. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Before we start prayer, let's take the time together to get head down, heart and soul, and we pray to God in order our activity will be blessed by Him. and everything going well. For those who are Muslim, I will lead. And for those who are non-Muslim, just pray on your own way. Bismillahirrahmanirrahim. Allahumma salli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad. Ya Allah, Ya Rahman. Today we will be holding an international seminar. We ask for your blessing and permission. Please bless our every step in action and make everything a value of worship and knowledge that is useful for us. Ya Allah, Ya Wahid, you are the one who made us unit. We pray, make this bonding tighter between us. Don't let the dispute happen to us. We want to be strong inside this unity. So we will be more useful for religion and our country. Ya Allah, Ya Ghafur, you are the forgiver for every sins. Forgive our sins, our parents' sins, our leaders' sins, our heroes' sins. Bless us and them within your protection. Ya Allah, Ya Karim. Take care and protect us from the coronavirus disease. Keep us away from the coronavirus disaster. Indeed, you are almighty over everything. Ya Allah, Ya Mujib, you are the one who grant the prayer. Permit our prayer and petition. Allahumma inna nas'aluka salamatan fid din wa afiatan fil jasadi wa ziyadatan fil ilmi wa barakatan fil rizqi wa tawbatan qabla al maut wa rahmatan indal maut wa maghfiratan ba'dal maut. Allahumma hawin alaina fi sakaratil maut wa najata minan nari wal af'a indal hisab. Rabbana la tuzigh qulubana ba'da idh hadaitana wa hab lana min ladunka rahmah innaka antal wahhab. Subhana rabbika rabbil izzati amma yasifun wassalamun alal mursalin walhamdulillahi rabbil alamin. Wassalamu alaikum warahmatullahi wabarakatuh.
Thank you to Mr. Sumrahadi. Now, before we yes. Now, before we start the main agenda, we will listen the national anthem Indonesia Raya and followed by Mars Indonesian National Nurses Association.
Ya, semua hadirin dimohon berdiri dan menyesuaikan.
nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan diri dalam membuktikan keberadaannya. Menapaklah dengan keyakinan lebih pasti, sejajar dalam abdikan diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia, bangkitlah dan majulah untuk menolong sekalian yang menderita. Kuatkanlah pribadimu, tingkatkan pengetahuan untuk memberikan asuhan keperawatan. Kita melangkah untuk mengisi pembangunan bangsa negara Indonesia, untuk mengantarkan bangsa menuju sehat semua dengan semangat jiwa Pancasila. Maju perawat, majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia, tercapai derajat kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan. Dengan organisasi PPNI yang kokoh, padu bersatu serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia.
To all attendees, please be seated. Thank you.
Para hadirin dipersilakan duduk kembali. Terima kasih.
Come next is welcoming speech and as well as opening this conference, which will be delivered by the Chief of Seminar Committee of this International Nursing Conference. To Nurse Iga Dewi Purnamawati, Master of Nursing, Pediatric Nurse Specialist, please welcome.
Selanjutnya, kami undang Ketua Seminar Internasional kita, yaitu Nurse Iga Dewi Purnamawati, Master Keperawatan, Spesialis Keperawatan Anak, untuk memberikan kata sambutan sekaligus membuka acara ini. Kepada Nurse Iga, dipersilakan.
Good morning. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Om Swastiastu. Praise and gratitude we give to God Almighty for the gift He has given us in the form of health, so that we can gather together at the 5th International Nursing Seminar. This conference is actually a collaboration of 4 nursing diploma academic in Jakarta, Indonesia, namely the Kris Husada, Pelni Jakarta, Pasar Rebo, and PGI Cikini, which this time took the theme treatment of child with cancer in the COVID-19 pandemic era. I would like to welcome to honorable guests, the Chief of Indonesian National Nurse Association, Mr. Hari Fadilah SKP, SH, Magister Hukum Kesehatan, General Chief of Association of Indonesia Nursing Vocational Education Institution, Ms. Yupi Supartini, SKP MSc, Chief of Region 3 of Association of Indonesia Nursing Vocational Education Institution, Ms. Silvana Evelinda, SKP, Magister Keperawatan. The Chief of Corporation Relation with Foreign Affairs HIPKI, Associate Professor Dr. T. Syahrul Reza. The speaker, Ms. Aucharia Patomwan, PhD, RN, Pediatric Nursing, Divisi Faculty of Medicine, Ramasibodi School of Nursing, Thailand. Ms. Professor Dr. Faridah Mohsaid, Lincoln University, Malaysia. Dr. Ale Nidekania, SKP MSc Nursing Program, University of Indonesia. Profesor Dr. Ajaya Suda, MSc, PhD, RNRM, PhD, University College of Nursing, Coimbatore, India. Director of Nursing Academy of Pelni, Ms. Buntar Handayani, SKP, Magister Keperawatan, Magister Manajemen. Director of Nursing Academy of Keris Husada, Nostatik Setiarini, SKP, MKM. Director of Nursing Academy PGI Cikini, Nurse Yeni, Magister Keperawatan, Spesialis Keperawatan Medical Bedah. And also the entire committee and the lecturer as well as the invites in participants who have attended. This international nursing seminar aims to 1. Build a culture of cooperation, communication, and coordination between nursing vocational education institutions. 2. Grow an understanding and concern for children with cancer as the subject of health service. 3. Build an understanding related to the care of children with cancer. 4. Build a network of cooperation with the Tri Dharma of national and international university. 5. Presenting the latest clinical experience in the field and disseminating nursing knowledge in children with cancer. Cancer, especially in children, is increasing every year. Cancer is a dangerous disease that can affect anyone, including children. Cancer can even attack the fetus that is still in the womb. There are several types of cancer that often attack children. Cancer in children is often not detected early because children sometimes find it difficult to convey the symptoms they feel. Cancer in children tend to be caused by genetic disorder or hereditary factor. Most cases of the cancer in children are only detected when they have entered the final or advanced stage. In fact, the chance of recovery will be higher if the cancer is detected early and treated early. The prolonged COVID-19 pandemic does not mean that the condition of children with cancer is neglected, but we must continue to look for a way on how children with cancer who might also be vulnerable to COVID-19 can be protected and safe. Based on the description above, the role of nurses is needed to help provide a comprehensive care for children with cancer and their family. The participants of this year's seminar consisted of Diploma 3 nursing students from 4 institutions along with invited and participants from outside those institutions with a total number of participants reaching 800 people. This international nursing seminar featured 4 speakers from 4 different countries, namely Thailand, Malaysia, Indonesia, and India. The speaker will explain to us how to manage children with cancer in the COVID-19 pandemic, and also give us the presentation which showing the type of cancer that often suffered by the children, such as leukemia, neuroblastoma, lymphoma, and osteosarcoma. The seminar also displayed the result of lecture research in the form of oral presentation. Hopefully, this international nursing seminar can be useful for all of us. So please, my close attention to the presentation of the speaker together during today's International Nursing Seminar. And my thanks to all who have helped a lot organization this seminar. I think this is the end of welcoming speech. Wassalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Om Santi 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 Om.
Thank you to Nurse Iga. The next welcoming speech will come from the Chief of Educational Nursing Vocational Institution of Indonesian Association. To Miss Yupi Supartini, Bachelor of Nursing, Master of Science, please welcome.
Berikutnya, kami mengundang Ibu Yupi Supartini, SKP MSc, selaku Ketua dari Asosiasi Institusi Pendidikan Vokasi Keperawatan Pusat, untuk memberikan kata sambutan. Kepada Ibu Yupi, dipersilakan.
Thank you, the Master of Ceremony, for the time given to me. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, selamat pagi, sawadika, suprapat. The honorable guest, Dr. Harifadilah, SKP SH MH Kes, the President of Indonesian National Nursing Association, PPNI, Ibu Silvana Evilinda SKP MK, as the Chairman of Region 3 DKI Jakarta, Association of Indonesia Higher Education Vocational Nursing Education Institution, the Director of Keris Husada, Akper Pelni, Akper Pasarbo, Akper PGI Cikini, who have a good collaboration to hold this international seminar. The honorable speakers, Aucharia Patumwan, PhD RN from Mahidol University, Dr. Alen Dekania, SKP MSc from Faculty of Nursing, University of Indonesia, Professor Dr. Ajaya Suda, MSc, PhD, RN, RM, PSG, University College of Nursing from India. All the participants, which includes Director of School of Nursing in Jakarta and all the delegates, the committee of the 5th International Nurse Conference. First of all, let's thanks to the God for his blessing us that this morning we are still healthy and could attend this international seminar. Alhamdulillah. On behalf of IFIKI, the Association of Indonesia Vocational Nursing Education, I would like to say congratulations to the Regional 3 of IFIKI who for this great event and very important international seminar, especially for us lecturer in nursing, especially pediatric nursing, all of our nursing educational institution. Thank you very much for always keeping a spirit in moving forward and guiding the member of IVK in DKI Jakarta to move forward in quality. As mentioned by the chairman of the committee, that the theme is the treatment of children with cancer. And this is very good theme and very important. As we realize that the incidence of cancer in children becoming increase and increase. And in fact, often the parents or the children come to the hospital for seeking treatment lately. This because of lack of knowledge among the community related with this disease. Then the problems appear to the children will also make them and their parents in the burden situation. The parents need prompt education and high support in order to care their children, especially during the difficult time in the hospital or during hospitalization. In these situations, nurses have very important roles to care, educate, and advocate parents and children to pass the difficult time while giving direct care to the children as they need. Direct care of nursing to the children, we know that it is a very specific, different with the care to the adult. So again, on behalf of IVK, especially General IVK, Central Board of IVK, we really thanks to all the speakers who for their knowledge and experience will be shared to the participants during this international seminar. I believe this will be beneficial for our colleges, lecturer of pediatric nursing who join this international seminar. Thank you to the participants. The great collaboration among for Academy of Nursing, Akper, Academy of Nursing Pelni, Academy of Nursing Keris Husada, Academy of Nursing Pasarbo, and Rumah Sakit PGI Cikini, who always hold hand in hand in increasing the quality of education in the nursing school. And also I appreciate to the committee who have been prepared this international seminar well, the 5th international seminar. So please continue this good collaboration and good event and important for us, especially a lecturer in pediatric nursing. Selamat mengikuti seminar kepada semua peserta. Good luck to you all. Dan khususnya kepada Presiden PPNI, Presiden Indonesian of National Nursing Association, kami sangat appreciate atas kehadiran Bapak Hari Fadila dan selalu mensupport semua kegiatan IVK. Thank you very much, Bapak Dr. Hari Fadila. Always support IVK in all activities. Selamat mengikuti seminar sekali lagi dan good luck for you all. Demikian dari kami, sambutan dari kami. Mohon maaf kurang lebihnya. And good morning, selamat pagi, sawadika suprapat. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. We ask for the willingness of Chief of the Seminar Committee to give certificate to Miss Yupi. To Nurse Iga, please welcome.
Kami mohon kesediaan Ketua Seminar Internasional Nurse Iga Dewi Purnamawati MKep Eskep Anak berkenan memberikan sertifikat kepada Ibu Yupi Supartini SKP.
Terima kasih Ibu Iga. Thank you Ibu Iga. Keep spirit.
Thank you to Miss Yupi and Nurse Iga. The next welcoming speech will come from the Chief of Indonesian National Nurses Association. Ladies and gentlemen, please welcome Nurse Rohman Azam, Bachelor of Education, Master of Nursing, Medical Surgery Nurse Specialist, representative of the Chief of Indonesian National Nurses Association.
Untuk kata sambutan berikutnya, kami undang Bapak Nurse Rohman Azam, SPD, Eskep, MKep, Spesialis KMB, selaku perwakilan dari Persatuan Perawat Nasional Indonesia. Kepada Nurse Rohman Azam, dipersilakan.
Thank you for the opportunity given to me in this international conference. Do you hear me, Ibu Susiana?
Yes.
Do you hear me? Okay, thank you.
Yes, I do.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, best wishes to all of us. The Honorable Chairman of the Committee, Nurse Iga Dewi Purnamawati, right? Chairman of IPK, Ibunda Bu Yupi Supartini, the Honorable Director of Academy of Nursing, PGI Cikini, Director of Academy of Nursing, Pasarbo, Director of Academy of Nursing, Chris Husada, and Director of Academy of Nursing, Pelni Hospital. Especially the Honorable for Speaker from Thailand, Patum Wan, PhD, Speaker from Malaysia, Professor Faridah Morsaid from Lincoln University, the Honorable Speaker from Indonesia, Ibu Dr. Aleni Dekania, and the Honorable Speaker from India, Professor Jayasuda. And for all of you participants in this seminar, it is a virtue we always convey our gratitude to Allah Subhanahu wa Ta'ala, God, because of His love, we can be present, we can be attending in the unity and a spirit of togetherness, spirit of collaboration that strengthens each other. Adalah satu keutamaan, puji syukur senantiasa kita sampaikan kepada Allah Subhanahu wa Ta'ala, Tuhan yang Maha Esa, karena atas kasih sayangnya kita bisa hadir dalam kesatuan, dalam semangat kebersamaan, dalam semangat kolaborasi yang saling menguatkan satu dengan yang lain. Ladies and gentlemen, we apologize because the President of Indonesian National Nurses Association, Dr. Hari Padilla, cannot join in this meeting, but his high appreciation was confined by the theme of this international seminar. Ladies and gentlemen, cancer nursing is one area that requires special expertise. All nurses can be made equal, but only the best can become oncology nurses. Nurses who provide care for cancer patients must have at least 4 core competencies, including first, skill in the conducting patient assessment. The second, able to prioritize and think critically. And third, can carry out many tasks, multitasking. And the fourth, have a good communication skill. Bapak Ibu yang saya hormati, perawatan onkologi, perawatan kanker merupakan salah satu area yang membutuhkan keahlian khusus. Semua perawat dapat sama, tetapi hanya yang terbaik yang dapat menjadi perawat onkologi. Perawat yang memberikan perawatan pada pasien kanker setidaknya harus punya 4 kompetensi penting. Yang pertama, terampil dalam melakukan pengkajian. Yang kedua, mampu memprioritaskan dan berpikir kritis. Yang ketiga, dapat melaksanakan banyak tugas, multitask. Dan yang keempat, memiliki kemampuan komunikasi yang baik. Ladies and gentlemen, cancer can be experienced or can be cured by anyone, including children. Even it can occur from birth. We know that cancer is the 3rd leading cause of death after infection and cardiovascular or blood vessel disease. Until now, there is still an understanding in the society that cancer is a dead cat. Kalau sudah cancer, masyarakat memandang itu sebagai kartu mati. In the past, di masa lalu, the cause of cancer was unknown. But today, it has been confirmed that cancer is a disease caused by genetic defect. Currently, the molecular biology approach, through the finding of various experts, that even hope to cancer patients who need to be informed to the public. To achieve a health Indonesian, preventive and promotive effort are priority in addition to curative and rehabilitative effort. The cause of cancer has been explained, and the location of genetic damage can be precisely detected, and the gain involved has been identified. Through the molecular biology approach, preventive effort, through early detection, as well as determining the diagnosis and the prognosis of cancer have been widely known. This is very helpful in the management of cancer. Previous impossible treatments such as gene therapy have arrived in the clinical trial and are becoming a reality. Bapak Ibu yang saya hormati, penyebab kanker sudah dapat dijelaskan. Dan lokasi kerusakan genetik juga sudah dapat dideteksi secara tepat. serta gen yang terlibat juga sudah dapat diidentifikasi melalui pendekatan biologi molekuler, upaya preventif melalui deteksi dini, serta penentuan diagnosis dan prognosis kanker sudah banyak diketahui. Hal ini sangat membantu dalam penata laksanaan kanker. Pengobatan yang tadinya dirasakan mustahil dikerjakan seperti terapi gen, kini telah sampai pada uji klinis dan menjadi kenyataan. Ladies and gentlemen, the future of oncology care will be influenced by the increasing number of patients diagnosed with cancer. Advance in the molecular biology will lead to more critical trial, targeted therapies, and the treatment decision based on the genetic makeup of patient and tumor. Nurses must stay abreast of ever-changing development and evolving science. Why? Because nurses are factors that will affect the quality of cancer care, the quality of oncology care, value system, cost, and patient satisfaction. It is critical for oncology nurses and Indonesian National Nurses Association, nursing organization for the nurses in Indonesia, to engage with all oncology care stakeholders, identifying the future need of oncology patient and the environmental in which care will be provided. Nurses themselves must identify the role that will be needed to ensure workforce that is adequate in number and trained to meet the challenging of future care delivery. In the nursing law number 38, 2014 and 14, it is stated that the Indonesian National Nurses Association function as university, constructor, developer, and the supervisor of the nursing in Indonesia. To carry out of this function, INNI or PPNI form a completeness body consisting of association, which currently we have 25 nurse associations based on their respective interests. One of these is HIMPONI, Himpunan Perawat Onkologi Nasional Indonesia, Indonesian Oncology Nurses Association. Ladies and gentlemen, for ending this speech, once again, PPNI, Indonesian National Nurses Association, appreciate every effort made to improve the complete competency of nurses. Keep working, unity, innovative, for even better services. Indonesian National Nurses Association also need to remind all of us during this COVID-19 pandemic to continue to carry out health protocol, both 3M or 5M, and make the COVID-19 vaccination program a success so that Indonesia and the world will be better. Once again, we express our high appreciation to all parties and all speakers who made this seminar a success. Congratulations on joining this seminar. Hopefully, the knowledge gained can be implemented in the daily professional practice. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. We ask for the willingness of Chief of the Seminar Committee to give certificate to Mr. Rohman. To Nurse Iga, please welcome.
Kami mohon kembali kesediaan Ketua Seminar Internasional Nurse Iga berkenan memberikan sertifikat kepada Nurse Rohman.
Thank you for your certificate. Thank you very much.
Thank you to Nurse Rohman and Nurse Iga. And now, ladies and gentlemen, let's move to the main agenda. We are going to have our conference session. I kindly invite our dedicated moderator, Nurse Samsinar Butar-Butar, Bachelor of Nursing. To Nurse Samsinar, I hand over this agenda to you.
Para hadirin sekalian, sekarang kita akan masuk ke acara utama kita, yaitu seminar yang akan dipimpin oleh moderator kita, Nurse Samsinar Butar-Butar. Eskep kepada Nurse Samsinar, dipersilakan.
Thank you to the Master of Ceremony, and thank you to the committee who have gave me the opportunity to lead this nursing conference as the moderator. Today, I feel honored to be your moderator. I am Samsinar. I am from Cikini Nursing Academy, Jakarta. As the MC mentioned before, that we have 4 honorable speakers, that all of them will talk about treatment of children with cancer in the COVID-19 era. As we know and aware of it, we are now in this COVID-19 era. We held this online nursing conference also because of the pandemic, but this condition doesn't make us to be vacuum, but we try to have a new lesson and experience from our speakers today. So to all participants, we hope you already prepare yourself to listen to the speakers. And we are lucky to have them. Without any further, I will introduce them to all of you. They come from Thailand, Malaysia, India, and Indonesia. To all speakers, I would like to say I'm sorry if I wrongly mention your name. The first speaker is Ms. Aucharia Patomwan, PhD RN, from Pediatric Nursing Division of Medicine, Ramati Bodhi School of Nursing, Thailand. Hello, ma'am. Say hi.
Morning. สวัสดีค่ะ
Sawadika. The second speaker is Professor Dr. Faridah Muhammad Said from Lincoln University, Malaysia. Hello, ma'am. Are you with us now? Hello.
Hello, Assalamualaikum.
Hello.
Good morning. How are you?
Fine. Okay.
Thank you for inviting.
Thank you, ma'am. The third speaker is Dr. Aleni Dekania, Bachelor in Nursing, Master of Science from Nursing Program, University of Indonesia. Hello, ma'am. Hello. Okay. The fourth speaker is Professor Dr. A. Jayasuda, Master of Science and PhD RN RM from PHG University College of Nursing, Coimbatore, India. Maybe she's not yet with us. Okay, our session will be divided in two sessions. We will have 2 speakers in the first session and another 2 speakers will be in the second session. Okay, the first speaker who will give the presentation is a speaker from Thailand. She is Ms. Aucharia Patomwan, PhD RN. Her topic today is treatment of children with neuroblastoma in COVID-19 era. I would like to apologize first for not being able to read the CV of yours, ma'am. I will read the CV. Ms. Aucharia Patomwan, PhD RN. Currently, she is an Assistant Professor, Director of Master Program in Pediatric Nursing, Ramati Bodhi School of Nursing, Faculty of Medicine, Bangkok, Thailand. Her experiences as a staff nurse and pediatric nurse, as a lecturer in Department of Nursing, as an assistant professor in Department of Nursing, Mahidol University, and recently as assistant professor in Ramati Bodhi School of Nursing, Faculty of Medicine, Ramati Bodhi Hospital from 2011 till now. She has various research, but the latest result was in 2016 until 2019 as a principal investigator in research regarding the quality of life among caregivers of children with the cancer during active treatment. She also, as a member many organizations, including the Thailand Nursing Council, the Pediatric Nurses Association of Thailand, and the Nurses Association of Thailand. She also received the various grant and awards. The recently doctoral program of study, Mahidol University in 2001. Ladies and gentlemen, that is the CV of our speaker today. Before we start, kindly I remind to all participants that you are allowed to give a question on the chat room. Please write your name and from institution that you are come from and to whom that question belongs to. Ms. Aucharia, you have 30 minutes to deliver your speech, ma'am. So Ms. Aucharia, time is yours.
Thank you very much. Thank you for your very kind introduction.
Thank you, ma'am.
Good morning and sawadee ka,
Sawadee ka.
everybody. And it's my great honor to be here to be a presenter in the 5th International Nurse Conference. And thank you very much for inviting me here. So my topic is on, let me share your screen first. Just a minute. Okay. Can you see my presentation?
Yes, ma'am. Yes,
Thank
ma'am.
you. Okay, so I work in the Ramati School of Nursing. So my experience that I'm going to share with you today is when I work at the Faculty of Medicine Ramati Hospital, which is the university hospital. It's a super tertiary care that provides cares for all the people in Thailand. But this hospital located in Bangkok. So they have 4 institutes. All 3 of them located nearby together in Bangkok, but the other one located in another province. Let me show you the first one, Ramati Hospital, and the second one, Queen Sirikit Medical Center, which is nearby Ramati Hospital. The third one is Somdet Pate Paratana Medical Center, is also on the same street. But the last one, the Chakri Narubadin Medical Institute, this one is the medical institute of our faculty and located in another province. It's in the Samut Prakan province. So this facility will be the main facility for training medical students of the faculty in the 2021. So this area usually provide care for the community who works in the factories and industry mostly, and also other places nearby. So the objectives for today, I will describe and share my experience regarding the treatment of children with neuroblastoma during COVID-19 pandemic era in Thailand. So this experience will be based on our hospital, which is a super tertiary care. And then I would, if I have the opportunity, I would love to discuss the issue related to cancer treatment during the pandemic. So neuroblastoma, as according to the St. Jude Children's Research Hospital, which is in the United States, that and has provided care for all and the research for all the children with cancer in the United States. They said that the neuroblastoma is a very rare type of cancer, usually diagnosed in the children before the age of 5. And neuroblastoma is a type of cancer that develops in the nerve tissues of the adrenal gland, neck, chest, or spinal cord. So even though they say that it's a rare type of disease, but it is the most common cancer diagnosed in infants for the first year of life. So, but by the time of parents and doctors notice the alarming symptoms, about 30% of the case, the metastasis process progressed already. And the 5-year survival rate of high-risk neuroblastoma patient is about 50%. According to the age and the characteristic of the cancer, we can divide the neuroblastoma into low risk, intermediate risk, and high risk neuroblastoma. So for the 5-year survival for high risk neuroblastoma is about 50%. So the main treatment of the neuroblastoma is as we know, we can do the surgery to remove especially in the low risk neuroblastoma, because if we can remove it at first, we do it. And then we can do the chemotherapy. Chemotherapy usually do with the high risk neuroblastoma, combined with the radiotherapy and the hematopoietic stem cell transplantation. When we use this hematopoietic stem cell transplantation, we need to have a very good supportive care during the transplantation in order to care for this patient. And after we use this, the chemotherapy and the stem cell transplantation, it can improve the survival rate of the children with neuroblastoma. So these are the consensus about the treatment of children with cancer during the COVID-19 pandemic. They said that wherever possible, children presenting with a likely diagnosis of cancer during this pandemic should undergo a clinical assessment and appropriate investigations to establish a confirmed diagnosis and offer effective therapy within the resources available while mitigating against the risk of exposure to COVID-19. So these are the consensus. But we don't have no international guidelines at the time. So the screening and the treatment decision must be made on a case-by-case basis, and also dependent on the state of COVID-19 during this time also, especially in Bangkok and all around the country, and also the availability of the resources. So what we do for managing to deliver usual care, cancer care, while minimizing the transmission of COVID-19. All children with cancer and their parents will be informed. We will tell them about the symptom of COVID-19. We give them the information, what are the signs, symptoms of COVID-19, and if they presented some of infection, they should tell us. And we also train them in terms of prevention of infection, especially hand washing, physical distancing from the crowds and sick people. Actually, all of these things, the children with cancer and their parents usually be taught during the cancer treatment even before the pandemic, but we emphasizing this during the COVID-19. And also the coronavirus, we do the testing for all by using the nasal swab for all patients and caregiver prior to any elective procedure or admission. When we would like to admit them to the hospital or do the elective procedure, we need to do the nasal swab for coronavirus. And if they need to be admitted to the hospital, we restrict accompanying person, either it could be the parents or the caregiver, just only to one per patient during the hospitalization until discharge, and they should be the same person at all times. And also we limit the risk of infection by restricting the access to the wards and implementing hygiene measure. Usually in the past, before the COVID-19 pandemic, we have the volunteers and teachers coming to the unit. But during the pandemic, we need to ask them not to come to the clinic to do any activity with the child. And professional, we do the monitoring of hand washing and the use of face masks by staff and families to make sure that before entering and leaving clinical area, they need to do that. When we provide care, if the doctor or the nurses go to need to examine the patient or go to do provide nursing care, we need to wear the surgical masks. We do not need to wear the PPE, the personal protective equipment like the gown or something that much, but we wear the surgical mask and make sure that we do the hand washing. And also we recommend the parents to do that also. The other thing is right now in the medical center, we have a lot of children non-cancer children. They coming for a follow-up, a lot of them. So sometimes if we can postpone their follow-up or their checkup, we will do that in order to reduce the crowds at the OPD. And also the elective procedure also reduce, whether it could be any surgery, minor surgery or anything like that. And also we we use the telemedicine. Actually, we experienced some home care programs before, like we have a home chemotherapy program before. But for telemedicine, we have tried once and with the patients during the maintenance therapy. But the parents, they are very concerned about if they get the telemedicine, the child might not. I would say that they would love to come to see the doctor more than just waiting for the doctor to call or telephone call or the video call. So we will do this, the telemedicine, in the survival group or the person who completed treatment more than 5 years. So potential challenge if we do this, the family member, digital literacy. Sometimes they don't have a mobile phone, or they don't. If the grandparents, they might have difficulty in terms of doing the video call or the telephone call, talking with the doctors. So these are the challenging. And also the viral testing for coronavirus. The Ramatibiti Hospital is the super tertiary care. So we provide this service for all people, not just the children, but also other adults, also other people from other area, can send the lab to the Ramatibiti Hospital to get tested. So the lab is available. We can send the patient and the accompanying person to get tested if they need to do the elective procedure or surgery. So if in case of the emergency visit, sometimes the children with cancer, they have some fever, or they have some rash or some symptoms. Sometimes they rush to the emergency. So we would tell them that during the emergency visit, the child and the parents need to be separation from other adults, patients, and other people in the area where possible. And recommend them to wearing masks and wash hands very often during waiting to see the doctors. And if that child need to be admitted to the hospital, we will send them to get the coronavirus nasal swab and also test the parents also. It should be done first. And we transfer them from the emergency unit to the ward, to the closed ward. We have the area for them to wait for the results. So if the COVID-19 come back negative, we will admit that patient to the hospital. In case at the OPD outpatient clinic for follow-up appointment, normally we will screen the patient and the parents. For the patients, we measure vital sign first, and especially temperature, body temperature. And the parents will complete the health assessment online. We have a QR code for them to scan, and then the parents answer the question on that day about whether they come close to or exposed to people that get infected with COVID-19, or they go to some place that are at risk for this. All those kind of questions in order to screen for the COVID-19 infection. And then if they don't have any sign of infection or has no risk of COVID-19 infection, he or she can see the doctor for a checkup and then get any onco and hematological treatment, as usual, maybe lumbar puncture, bone marrow, or get chemotherapy, so they can get that. And then after that, they can go home. Before that, we emphasize them on social distancing and use of masks and hand hygiene. But for other cases, if we found out that a child that come to the OPD presenting some symptoms that suggestive of infection, we will separate them and send them and the parents to get the COVID-19 nasal swab, and separate them to the closed room. But if the child coming from the Bangkok is in the same area of the hospital, we will ask them to go home and wait for the result of the nasal swab. But if they coming from the rural area, we will send them to the closed ward in order to wait for the results. And if the result will come back on the same day, so if the negative test result is mandatory in order to carry out any activity, so we will not postpone any activities for the child, especially during active treatment. We still ask them to come, as scheduled, and provide any procedure at regular checkup. We can do bone marrow aspiration, a biopsy, or lumbar puncture, and give the chemotherapy. We have a separate room. We can do the chemotherapy at the outpatient also. But the staff, oncology staff, need to implement all the preventive measures and control who have access to the setting. So these are what we do for the children under active treatment. They will still receive chemotherapy, radiation therapy as scheduled. We will not postpone their follow-up. But for children post-treatment surveillance and they do not have infection, we will postpone if they are stable. But this group are stable, but they still need a regular consultant. So for children completed treatment for 6 months to 1 year, this group need to get a lab tested. They need to come for imaging, CT, MRI, or check the tumor marker. So we will still need to ask them to come to the hospital to get that, because sometimes CT scan, MRI, imaging will not be postponed because it is very difficult to reschedule. But for children who completed the treatment for 1 to 5 years, who do not have health problems and are stable, we will postpone the follow-up for 1 to 3 months. And the children who completed treatment more than 5 years and are stable, do not have any health problem, we will postpone them for more than 3 months. Okay, so that we're trying to postpone all the schedule for the one who are stable. But potential challenge is during at the OPD. I told you that we need to do the screening for the patient and the family. Sometimes they do not provide the exact timeline that sometimes they exposed to someone with confirmed infection with COVID-19 at home or other places. So there's the possibility of the spread of infection, because right now we have one case that they don't tell us that their father has infected with the COVID-19. So we don't know that that boy has get exposure to that. So right now we need to do some other measure for the people who get contact with this patient, both the staff and everybody at the OPD. The other treatment is a surgical removal. We can also do that. Usually we do in the initial phase of neuroblastoma, and then we can do before or after the chemotherapy to treat the children with medium risk. So the surgery, if the child need to get the surgery, they need to get tested for coronavirus 24 hours prior to surgery. And if the result is negative, we will ask the child and the parent to be admitted to the hospital. So, but if the results come back positive, they need to be transferred to the units. Other units, I told you that we have Chakri Narubadin Institute, which is in the other province. We will send them to that hospital in order to get treated. And for chemotherapy, these are some of the main drugs that we use in neuroblastoma. And during this time, the chemotherapy can still be provided, especially for the newly diagnosed who need the active ongoing treatment. We will not interrupt the treatment. So we ask them to come in to get chemotherapy, or sometimes we can also admit them to get the chemotherapy. And we follow all the preventive measures and basic principle of infection control. And radiation therapy. During the radiotherapy, the child need to be lying still on the table. So if the child can lie still on the table during the radiation, they do not need to be admitted to the hospital. Okay, because we need the beds for other patients. So, and this group of patients do not need a COVID-19 nasal swab. They need to travel from home to the hospital every day in order to receive radiation therapy. You might think that this might be a risk to get infection, but when we outweigh between the number, the capacity to admit the patients and the risk of getting COVID-19 infection, we cannot admit them. But the children who cannot lie still on the table during radiation is needed to be admission in the hospital. And when we admit them, they could be either sedation or anesthetic before RT, so they need to receive nasal swab and hospitalized until finish RT, maybe 2 weeks or something, and limit only one parent to stay. The challenge for if we do anesthesia for radiation therapy in young children, it might cause the spread of COVID-19 infection because we need to insert the intubation in order to do the anesthesia. So we need to send them to receive the nasal swab before the anesthetic. And if the result positive, we will withhold the radiation therapy until they recover or virus free. For non-admission patient, this one I already told you that they might be at risk from traveling from home to the hospital every day. So according to the hospital policy, we need to limit the admission to the unit for radiation therapy because limited number of hospital beds. But we have a remote support. The parents can also call us or video call or use the line application with the oncology nurse and the staff, the physician, if they have concerns on their child symptoms in order to reduce the non-urgent visits to the OPD. If they just line or call us first, so we will tell them maybe this symptom do not need to come to the hospital, and this will reduce the non-urgent visits. And for the transplantation, usually it's not recommended for malignant disease. All donor and recipients are required to get tested to confirm the exclusion of COVID-19 infection. For the staff, everybody need to get the vaccination for coronavirus vaccines. And in order to provide care, because the policy said that the nurses, the physician who provide care to the children needs to be vaccinated. And every week, they will need to do the self-assessment by scanning QR code and answer online about their timeline and everything. The staff will follow the basic infection control and use some appropriate personal protection as appropriate when contacting with the suspected COVID-19 patients. But potential challenge is the number of staff who have received coronavirus vaccine right now has not reached 100%, because some staffs, they believe that sometimes they just want to wait for the alternative vaccines. Sometimes they prefer Pfizer or Moderna, but we have AstraZeneca and Sinovac, but they don't want to get that. But right now, so the hospital said that if you do not get vaccinated, we will not let you take care of the child. And right now we have the staff. Sometimes right now the hospital will not expand any service because we already do that as a fully capacity already. So right now, if the staff get infection from COVID-19, we will have some staff shortage. We need to rotate some nurses or practical nurses from other unit to come to rotate and take care of in the hospital, because some of the people might be need to be at home, and some might be need to be quarantined, and some might be admitted to get treated. These are some of the video that I would love to show you about the Jagrina Bodin Medical Institute, that they provide the clinic and they to test for the adult and the children who might suspected of COVID-19, and also the room that we will admit the child, like a cohort ward and the ICU, which have a negative pressure room. This come from the knowledge from Thailand International Cooperation Agency. So thank you for that.
Good afternoon. I'm Thane Piti Thamapan. I'm responsible for the facility management of the hospital. During the COVID-19 situation, we dedicate a new building which will be the premium clinic in the future, but the building is still closed. We use this building to look after the patient with COVID-19. As you see, we have the ARI, Acute Respiratory Infection Clinic, in the building, and we have the inpatient section in the building. So I will show you. Please follow me. Welcome to the AI clinic, which is situated on the second floor of the building. So I will take you to have a look inside, and then we'll discuss later, okay? This way, please. In the clinic, we decide to make the patient go only one way. There is no return of the patient. And if you see, this is the waiting area of the clinic. You see the chair for the patient, which we designate that where the patient should be sit and wait. And then we go to the exam room, which is here. I will show you one of the exam room. Inside the exam room, we have everything equipped, like the screen, the protector, the torch, the stethoscope, and the computer. Everything is prepared. And when the doctor comes, they wear the PPEs and they examine the patient. If they decide that the patient has to be X-ray, for like chest X-ray, we have the X-ray facility in the same area. You can follow me like here. Behind me is the X-ray room. The patient, after examined by the doctor, if the doctor decided they have to do the chest X-ray, the patient will be here and do the chest X-ray here. This is because we don't want the patient to go anywhere else in the building. So we put everything inside the AI clinic so that the patient can do everything at one step. And after that, the patient can go out of the clinic by passing to this door. After everything is finished, the patient get the medication here. Here we prepare the essential medication for the AI symptoms. For the patient who has no COVID-19, and they get the medication back home. When the nasal swab is needed to be done, the patient will be sent down here and they enter the facility. Inside the facility, we have the negative pressure for the patient part. Let's see. This part is negative pressure. And we have the screen. And inside the screen is the positive pressure for the doctor who does the swab. After the swab is done, the patient is sent back home and they wait at home for the result for 1 or 2 days. If the result is positive, they will call back to the hospital to admit it in the same building. This is the ward for the COVID-19 patient or cohort ward. The patient who is positive for COVID-19 but asymptomatic will be admitted here. Behind me is the nurse station, which we modify to have the positive air pressure. The air will move from the inside the nurse station to the hallway. And then if you come through the hallway, you will see the red line. This indicates the dirty zone, and here is the clean zone. The staff who work with the patient will be only in this red line and never cross to this side until they clean themselves already. And this is the patient room. We have the infectious waste bin in front of the room because the medical staff will change their PPE around here before getting inside the room. And this is inside the patient room. This room we can look after for 2 patients. The first patient is here, and the second patient is here. In the room, we have a video call for the doctor to do the history taking here. The doctor will be in the nurse station, and they contact the patient using the video call. Inside the room, we close the outside air unit. We obstruct it so there is no air pass into this route, and the air condition pass through here. Doing this will cause a negative effect to the room, and the air pass from the door, the air pass from under the door into the room, and we turn on the exhaust fan in the bathroom here to enhance the negative pressure effect. This is how can we do the negative room for the patient. This is a negative pressure room for symptomatic but non-severe patient. We take care of the patient inside the room. If the patient gets worse, they will be moved to the ICU. We modified the intensive care unit to be the negative pressure ICU. We have the negative pressure ICU. We have two parts. The first part is the empty room, which should be minus 2.5 kilopascal. It should be minus 2.5 Pascal. And inside the standard ICU should have at least minus 5 Pascal. Let's go inside. Inside the room is the normal standard ICU. The air will pass through the HEPA filter outside and pass through the patient and get exhausted here. The patient lie down on the bed and the medical doctors work beside him. When the patient cough or the secretion of the patient or aerosol generating procedure has been done, the aerosol will pass to the exhaust, and this decreases the contamination of the medical staff. During the COVID-19 situation, we took care of almost 150 patients, and we've learned that when a number of patients has an aggressive behavior, and this can cause danger to our medical staff. So we decided to use the U-shaped pole to alleviate the situation. We have an example to use this. During the aggressive behavior situation, we use this kind of pole for the security officer to prevent the patient to come close to him. And this, we can have some time to change our clothes for PPEs. COVID-19 is the devastating situation that happened all over the world. Facility management, safety and security are important parts that help us to take care of our patients. I hope you do the best for your country, and good luck.
Okay, so that would be, hello. I'm sorry, I just get stuck. So that would be my end of presentation, because I take much of the about more than 35 minutes. But from my PowerPoint, you might see some of the example of the bone marrow transplantation, but that is done with the children with thalassemia. So I would that case would be the first case that is successful to do the bone marrow transplantation, even though it's not cancer. But that case, we already gave the high dose chemotherapy to the patient, and the day that we need to collect the bone marrow from her brother, we found out that her brother got infected with the COVID-19. So we cannot postpone any transplantation. So even though we have the risk to get infection to the staff or to the people surrounding that, but the doctor has decided to do the bone marrow transplantation on that children with cancer who is about 7 years old, and his brother, her brother is 5 years old. So I'm sorry that I cannot show in this screen, but I think in your PowerPoint you might see that I have 2 slides at the end. So
Yes.
thank you very much.
Thank you. Thank you. Thank you again to Ms. Alcharia for the nice presentation, ma'am. I'm asking you to stay with us until the second speaker is delivering her speech.
Thank
Okay?
you.
Because there are many questions to, goes to you. We move forward to the second speaker. Is from Malaysia. She is Professor Dr. Faridah Muhammad Said. Her topic today is a treatment of children with lymphoma in COVID-19 era. I'd like to apologize first for not being able to read your CV, ma'am. I will read the CV of hers. Professor Dr. Faridah Muhammad Said recently she held the position as an acting director, quality and patient safety, Prince Muhammad bin Abdul Aziz Madinah Hospital from 2016 till 2017. Her experiences as a nursing program assessor, as a nursing curriculum developer, as a coordinator for the international study in mobility, and recently as acting director, quality and patient safety, Madinah Hospital from 2016 and 17. She has various research. One of them is about breaking through the silence using action research to develop health education material on HIV/AIDS for deaf community. And she also a part of many organization or institution. To Professor Dr. Farida, you have 30 minutes, ma'am, to present your speech. Again, I remind to all the participants, please send your question through the chat room and don't forget to write down your name, your institution, and that to whom that the question belongs to. To Professor Dr. Farida, time is yours.
Thank you. Thank you for a very lengthy and very good introduction. All right. Can I share? Can you all hear me?
Yes, ma'am.
Yes, okay. Is my slide audible?
Yes, ma'am.
All right, okay. All right. Okay, before I start, Assalamualaikum warahmatullahi wabarakatuh. Good morning and Sawadika. And I don't know how to speak good morning in Tamil or India. So good day for everybody. So my topic today is a treatment of children with lymphoma in COVID pandemic era. All right, but first of all, I would like to thank the committee and all the nursing leaders who is inviting me for a very good sharing platform for the education for all the nurses. Okay, and we all in Malaysia say nurse boleh. Okay, I'm Professor Dr. Farida. I'm currently in Lincoln University College as the head of postgraduate studies. And this is where I'm work. Okay, I'm in Lincoln University, fifth. It is more. It's very well recognized and high impact factors, high impact university in Malaysia, and I have about 124 PhD students. All right. So whoever interested, you can always contact me. All right. Okay. So to start with my presentation, let us make some dua for all those people who are, especially the children that we are focusing now to have a good life. May Allah grant every sick complete shifa, expiate their sins for every movement and suffering, and grant them with a quick recovery. Amen. So the goal of my presentation today is to share and become more familiar with lymphoma as a disease, the treatment modalities and side effect management strategies, and to use this knowledge to improve and maximize patient care during COVID-19 pandemic. So the earlier presenter has already mentioned about neuroblastoma. So now we are talking about what is lymphoma. See, lymphoma is an immune cancer which is developed by a diverse group of disease that originate in the lymphatic system. Everybody knows what is lymphatic system. How important is the lymphatic system? Because of this diverse group disease, it developed as a malignant disorder of reticular endothelial system, or sometimes they call it RAS, RAS, and result in the accumulation of dysfunctional immature lymphoid cells. So we know that lymphoid cells is very important in our defense mechanism or in our immunity. All right. So lymphoma is, as Rahman was saying, that what cancer is third most common cancer in children after leukemia, brain cancer, as well as what do you call that, spine cancer. So the incidence rate is 15 in every million children, 15 per million children. That means they are very high risk case. And there are two broad categories of lymphoma. They have Hodgkin disease, and another one is non-Hodgkin disease. So if you are familiar with that, I think everybody should be able to recognize the Hodgkin and non-Hodgkin disease. Right? So how to differentiate between those two? Hodgkin disease normally affect the younger adults, whereas in non-Hodgkin is more of the older adults. The identify of that Hodgkin disease is by the presence or the existence of the red Standard cells, and the successful rate or the survival rate is high, and based on the treatment of all those cocktail, the MOB, the COP, and so on. All right. Whereas in the non-Hodgkin disease is based on the classification of the cell line population, the B cells and the T cells. All right. So I'm not going to go further on that because we're going to focus what are the treatment. So this is another lymphoma type differentiation which you can get in any of those websites. So again, how they differentiate between the lymphoma and non-Hodgkin and non-Hodgkins, you see. Hodgkin is more on the younger generation, whereas the non-Hodgkin is more on the more of the older generation. Okay, so if you look at the stage at the presentation, so if the presentation is always in the early stage 1 and stage 2, that means that there's only singular nodules there. But in non-Hodgkin, it's already on the late stage 3 and 4. So that's make how the survival rates come through. Okay, so you see that the Hodgkin is much survival rate is much better compared to the non-Hodgkin. Again, it is depend on the treatment. So I'm not going to go on that. I'm just focusing on the setting. Okay, what are the cause factors? As everybody has been discussed earlier on, the cause of lymphoma in most cases is not certain, because the cause is very they said not known causes of lymphoma. However, they already identified what are the risk factors of lymphoma. There are several risk factors linked to lymphoma, including the age, as we mentioned earlier on, the younger age and the older age. If the younger age, they will look into the family history, maybe there is some hereditary or something. And then they have certain infection. They have a lower immune systems, and they have some issues of autoimmune conditions. And they also have another different factors. So all this you can get from all these publication, which you can access through the website. So these are some of the common causes of the lymphoma. All right. So what is the lymphoma incidence here? As I mentioned earlier on, incidence is 1 in 7,000 children for 0 to 14 years old. So they are more of the younger generation. Likelihood of young person reaching adulthood and being diagnosed with cancer during childhood is 1 in 300 for male. All right, 1 in 330 for female. That means that male or female is more high risk. So you have to think about that, all right? So if you look at that 300 for 1 in 300 for male, 1 in 330 for females, so you should be able to guess who are the most high risk in terms of the gender. All right. All right, so now I'm sharing you some of this data from the Global Cancer Observation, the International Agency for Research on Cancer 2018. So what you can see here, it said estimated age, standardized incidence and mortality rate for cancer in children aged 0 to 14 in 2018. So if you look at here, we have so many numbers in all these developed country or developing countries, all right? But not many in the Asian countries or those developing and underdeveloped country. So, but if you look at, they have a very high risk, they have a very high cases, but their mortality is low. Compared to the Asian, they have a very few cases, but their mortality rate is high. So what are the causes of that? They said that because of earlier on, previous speaker was saying that the awareness when they come to the hospital already in the late stage. So that is one of the factors why our mortality, especially in Asia, is very high. All right. Okay. Okay, now I'm sharing you some statistics on cancer in Malaysia. Approximately 70% of children's childhood cancer are curable and early diagnosis and treated in the appropriate protocol. Okay, and leukemia, brain cancer, and lymphoma are the most common cancer for the children below 14 years old. And Hospital Kuala Lumpur Oncology Unit is the biggest Malaysian and sees around 200 new children cancer cases a year. That means quite a lot. The number, as Ms. Iga was saying, the number is increasing. Cancer is the second leading cause of death in children aged 5 to 14 years. So that means that how important we have to create awareness among the children, among the community, the importance of early diagnosis for the children, because it is curable. All right. So I want to share with you with some of those statistics that are new. Epidemiology of childhood cancer in Indonesia, in study of 14 population-based cancer registry. And based on that, so you can look from this data, the conclusion was the coverage and quality data of childhood cancer in 14 population-based cancer registries data were low. Each population-based cancer registry should improve the process of cancer registration. All right. So another one that I because I want to have a good evidence to share with you. So this is another article. They said childhood cancer is not a top priority for the Indonesian government. The management and the care of children is very limited, with almost no form of cancer control program, limited diagnosis tools, and a few national recognized protocol for the treatment of childhood cancer. So I hope this is the whole information, but this is what I'm sharing. So I've tried to get more information, inshallah. I hope by now it's already been improved. All right. So for the treatment, okay, as shared by the previous speakers, I'm not going to go on detail about that. There are different types of treatment. They have chemotherapy, which kills all the cancer cells. And you have a radiotherapy as well. Same properties with the chemotherapy. They want to kill the cancer cells. They also have surgery to remove the tumors. And they also have the monoclonal antibodies. They also have the stem cell and supportive care. So what I'm focusing now is more of the supportive care during the COVID-19. So because the chemo radiotherapy, it will be almost the same for all the countries, right? So because we want to manage children with cancer during the COVID, we have to know what are the side effects or the adverse effect of the treatment, okay? So when they have all those chemotherapy, radiotherapy, and so on, so they have all these symptoms, like hair loss, nausea, vomiting. So they are they have so many, that depression, fever, bleeding, and pain. So this is some of the what do you call that, symptoms that they have. All right, okay. So according to the studies here, radiotherapy of pediatric lymphoma, they said the response of therapy was 80.5% at the end of the treatment and 78.8% after 2 years of follow-up. That means that the effectiveness of the treatment. And early and late effect of treatment manifesting as anemia, pancytopenia, normal tissue toxicity. So this is some of those normal, what we call that, adverse effect after the treatment, like the pneumonia, fibrosis, lung fibrosis, cystitis, endocarditis, hepatic dysfunction. So this is all the normal presented by person with after the treatment. So this is the same study where they put in a graph what are the effects of the treatment. So you can see that nausea is vomiting, and alopecia, hair loss, oral. This is the most common and the highest. Which are the most highest is the vomiting, okay, hair loss, and oral oral ulcer, fatigue. So this are the most common, which the nurses has to be able to identify when caring of patient with the cancer treatment. So these are the things which the nurses should be able to identify, because when you're able to identify, this is a very simple nursing measures that they can provide health education to the parents and the patient. All right. So now we move to the next interesting topic. What impact can COVID-19 on the treatment of lymphoma children? Say, okay, children cancer is like highly curable disease when accurate diagnosis and timely appropriate therapy are provided. However, during the COVID-19 outbreak, majority of these children suffering the consequences of resources reallocation, treatment delay, interrupted or substantial modified treatment. Because of this, they put a high risk implication for cancer children. So what are the high risk cancer? Children with cancer are immune compromised children, right? So everybody knows that when they go for the treatment, they are the immune compromised patient. So when they have that, they have a very high risk of developing serious complications because of the infection, right? And they are also 4 times risk of hospitalization compared to other normal children, right? They have a higher morbidity and mortality associated with the respiratory virus infection if you compare with the others. So they are the most high risk, most vulnerable patient to us. All right. So they need to have a very good care. All right. So this is some studies to say global study from June 22nd to August 21st shows that 311 healthcare professionals at 213 institutions in 79 countries with aim to investigate the effect of COVID-19 pandemic on childhood cancer care worldwide. So outcome of this study shows that they have substantial affected childhood cancer diagnosis and management worldwide. That means that all the new cancer diagnosis will be delayed. More prominent in low and middle income countries, countries like us, okay? And they also have an unavailability of the chemotherapy agent and interactions of the radiotherapy, like our previous speaker was saying. If it is necessary, then only they will admit the patient for the radiotherapy. All right. So this is some of the publication on what are the disruptions, what are the what do you call that, services that been interrupted. Okay, so they show here unavailability of the chemotherapy, disruptions of the surgery. They will hold on the surgery because they don't want to expose the patient, as well as I think most of the hospital already maximize the hospital for the COVID patient. Disruptions of radiotherapy, reduction of bone marrow transplantation, decreased availability of imaging, decreased the route in laboratory tests, disruption in pathology service, so this decrease in availability of the blood product. Because during this COVID-19, they are more focusing on how to save a life for this COVID-19 patient. Not only on the services, the disruption also falls on the patient support system itself. For example, for the family and for other types of patient support. And secondly, what is disrupted is that the availability of the clinical staff itself. Okay, because many staff, some of them may be being taken to a more needed area, so they have limited staff there. And 7% of hospitals closed for their oncology service. Sorry? And 19% reduced the availability of the pediatric oncology beds during this time. All right. 43% decrease in newly diagnosed pediatric cancer cases. And 34% of institutions reported a decrease in treatment continuation. So they try to hold on to the, if possible. If not possible, they will continue with the treatment. There's no disruption. All right. So another studies done in Saudi Arabia. So what is the impact of COVID to the children with cancer? So I just want to highlight table 2, behavior and mental characteristic of the children. So the children also have some impact on mental well-being. You see, they have anxious about the contracting of the virus. So besides that, they have stress and mental health status being distracted by the disease, but they also worries about the virus as well. All right. And so do the children. When they have a bit of symptom, they are worried that they are being contacted with the coronavirus as well. So this is some of the mental health status of the children with cancer. And so far, percentage of patients who experience delay in treatment during pediatric, during the pandemic, majority have experienced that. And they found that telemedicine, as been discussed earlier on, telemedicine is the best way of how to reduce the contact with the hospital. Okay, all right. And majority are very comfortable with the all the precaution taken in order to reduce the spread or the transmission of COVID-19. Okay. All right. Okay. Now let us look at is this COVID-19 really affecting the children? If you look at in many papers or many researchers, they found that little is known why children is less susceptible to COVID-19. So they said we are talking about those children, younger children. Okay. Confirmed COVID-19 children are very low compared to the adults. Medline and PubMed database report children with cancer only found 2 articles on those children with cancer who are affected by the COVID-19. One case reported in China of child affected by acute lymphoblastic leukemia and maintained therapy who developed a respiratory distress. Survey of 89 pediatric hematology oncology units of 32 centers of a different countries shows among children receiving treatment for their tumor, only 9 children were reported affected by COVID-19, but 8 of the 9 confirmed cases were asymptomatic or with mild illness. So this is very strange. It's unexplainable. So they are going on for further studies on that. So how are we going to overcome all these side effects experienced by the patient? Nurses are very important and in identifying the report adverse effect and provide the best care. As I mentioned earlier on, they are the ones who should be able to recognize what are the most sign and symptom of side effect experienced by the patient. Be aware of the patient's regimes and observe for the toxicity associated with the drugs patient receive. Share information with your pharmacist and the patient's provider. Who is the patient provider? Well, they are all those, caregiver. Be proactive. Your suggestion and intervention is very vital to save and rapid recovery of the patient. Okay, what shall we do? Okay, as I mentioned a lot earlier on, majority of these side effect is very common, like increased risk of bleeding, increased risk of infection, nausea, vomiting, diarrhea, poor appetite, sore in the mouth, and hair loss. So this is common. All right. So during bleeding, so what should we do? Because of the chemotherapy will increase the chances of bleeding. So we advise them to prevent any injuries during their toothbrush, cleaning the tooth, avoid nail clippers, and monitoring for bleeding are recommended during the periods when the patient has a low platelet count. So this is very important. Finding suggestions that increase the knowledge level of caregiver on bleeding risk and prevention and protection measures may facilitate the protection of the children. Right. Another area which will be very highly recommended for us to teach the children as well as the caregiver is the nutrition implication. Okay, because the chemotherapy may affect the child nutritional status by causing nausea, vomiting, taste changes, and diarrhea. So 66% of children experience fluid volume deficit, although fluid resuscitation is very important. So what is our advice? We have to advise them to drink plenty of fluids. So either it can be based on the children's flavor, and we can advise them to have a small frequent meals and water as usual. Okay. Study shows no relationship between the new neutropenic diet and infection. So there is no relationship between the infection and the neutropenic diet. However, neutropenic diet is administered in most of the hospital when a patient is undergoing chemotherapy. So what is the
I
yeah?
apologize to interrupt, ma'am, but you have 2 minutes left.
Okay, all right. So the neutropenic diet is neutropenic diet is something to do with any diet that to reduce infection. All right. So, all right. So I think this is normal that the mental health. I think the nurses should be able to do what is the mental health treatment for the children. Okay. So what we have to do is to empower the caregiver. All right. So many studies have shown that if you empower the parents of how to do infectious risk, reduce the infectious risk, breeding risk, and nutrition risk, they can improve the health status of the children. All right. So what is the additional care during the COVID-19 era for children with cancer? All right. So vaccinated cancer patient against COVID-19, expert address major uncertainties, all right? So it is encouraged for those that there is no current evidence that the vaccine might be risk to the immunosuppressed patient. That means that the patient is have low risk of should be given any vaccine. They should be given a COVID-19 vaccine. So this is proved by the Royal College of Physicians. All right. So who are those people? They are considered under the underlying health condition patient. All right. So again, reinforcement of what the previous speakers have said. It is very important during COVID-19, the screening and surveillance of the patient and the caregiver during their visit to the hospital. So they need to be screened, okay, to avoid any high risk of infection, all right? And strictly apply hand and respiratory, the hand hygiene and respiratory hygiene. So they have to put on the mask. And of course, they have to apply restrict what we call that social distancing. There must be some distancing stand. So try to avoid overcrowded area. So the prioritizing of the pediatric cancer patient, newly diagnosed patient, they said they should proceed if it is necessary. For active curative treatment, modification of the treatment protocol is required to decrease hospitalization and neutropenia during or duration without the survival impairment. Follow up as usual. If they should be able to postpone, they can postpone the follow up. So what have the Indonesian government follow the guideline? So based on this, they said Indonesia is preparing for the skyrocket COVID-19, and they follow the model by Udi et et al., and which is the model used by the Washington DC. So they have the patient trial education for patient, family through hands-out website and strengthening by policy stay at home. So another area that now everybody is adopting is the telemedicine, another important part of their strategies, cancer surgery with their priority with the PPE team members and bed capacity whenever they are available. So this is again the assurance of the importance of PPE, hand hygiene, and screening for any COVID-19. Okay, somebody has mentioned about the remote support. So remote support is another highlight of the treatment during COVID-19. And lastly is the dedicated staff pathway and continuing healthcare education is also very important. Right. Okay. So in conclusion, most caregiver and children undergoing anti-neoplastic treatment are well trained to avoid situation of infection risk. Yes, I think most of them are well trained. Frequent hand washing, use of face masks, and avoid crowded places or contact with people with respiratory disorder are suggested by any pediatric oncology community. New transformation, a growth interest during the new norm is developing and adapting new technologies, mobile, tablet, and personal computers to facilitate communication. It's very important communication between the patient and their caregivers and to reduce the frequency of access to the hospital. Okay, with that, I said thank you.
Okay, thank you again. I deliver to Professor Dr. Farida, to both speaker for those nice explanation about our topic today, which is the treatment for children with neuroblastoma and lymphoma. Well, we are now going to have a discussion session. We have many questions here. I will read one by one. Maybe after I read the questions, I please to all speakers just directly to answer the question. The first question came from Jessica from Cikini Nursing Academy. She would like to ask to the first speaker, to Ms. Aucharia. Hello, Ms. Aucharia, are you with us?
Yes.
Yes. Jessica is asking you what kind of problem that the nurses usually encounter when they are giving a treatment to neuroblastoma patients.
You mean during the COVID-19 pandemic,
Yes.
right? Okay.
Yes.
Normally, we can still provide a regular, routine treatment, whether it could be provide nursing care or giving chemotherapy at the outpatient clinic or in hospital inpatient clinic. And we also have another unit we call short stay. The short stay unit, we will give chemotherapy and for the children, and they do not need to stay overnight. So we call it short stay, and we don't have any problem providing the care for the children who are uninfected. Yeah.
Okay, thank you for the answer. The next question also goes to you. Came from Dea Chantika from Cikini Nursing Academy. She would like to ask you 3 questions directly. The first one is what the alternative are recommended for children with advanced neuroblastoma during the COVID-19. The second is, does it not have a big impact on children when they go to the hospital during this pandemic? And even though the child immune system is low, so it is easy infected with the COVID-19.
Okay. For the alternative treatment, right?
Yes,
so
yes.
I told you that the main treatment are surgery, chemotherapy, radiation, and the stem cell transplantation. So mostly for the low risk neuroblastoma, we can do the surgery. But for high risk group, we use the chemotherapy combined with the stem cell transplantation and the supportive care. So that would be the model treatments for the children with neuroblastoma. And is the second question again?
The second question again, they are going to the hospital, right? They have also immune system, the immune system is low.
Yeah.
That is the condition that we have concern about. What is your suggestion about that?
You mean the children, they are the immunocompromised host,
Yes.
and get the infection.
Infected, yeah.
Right. So the day that they come for a follow-up, as I told you, that we will screening the patients and the family member, and also get the blood test on that day. And if they have a very low white blood count, especially neutropenia, we might not be able to do any chemotherapy on that. We might ask them to go home and, treat them with sometimes the white blood cell can go up, by itself, maybe 5 or maybe 7 or 10 days after the chemotherapy round. But if not, we can also give them the stimulation, the drug stimulation for white blood cell. We call the GCSF or something like that for them. So in order to increase their immune. So if they have a low immune, or maybe less than the neutrophil count less than 1,000 cells, we cannot do any chemotherapy. So that's what our procedure. Yeah, and we tell them strictly about wearing masks, hand washing, and physical distancing.
Okay, I think it's quite satisfied with the answer. The next question again goes to you, ma'am. The question came from Pasar Rebo Nursing Academy, Alpen Japana. They are he asking about, other than the nasal swab, is there any more effective test to detect COVID-19 for patients with neuroblastoma?
I'm sorry, I cannot hear clearly. Yeah.
You
Yes.
You told before that you are doing nasal swab for the patient if they are doing the procedure, right?
Yes.
He asking about, is there any more effective test?
The nasal swab for COVID-19.
Yeah.
We provide for the patients and the family member who will get the elective procedures or admit to the hospital. But if they do not have any suspected for COVID-19 infection, we will not do that. And if they come to the emergency unit, we also screen them for that if they need to get admission to the hospital also. And the cost for the COVID-19 nasal swab is around 2,000 baht something. So we tell the doctor that try not to prescribe the stat, do not need stat, because if we need the lab test, immediately the cost will be increased. Okay, so usually we will cover for the cost of the COVID-19 nasal swab. So I'm not sure that I answer for your question, but I think I read from the chat that somebody asked me about if the family members also have the suspected symptoms of the COVID-19. We will send the family to the ARI clinic, acute respiratory infection clinic, to get tested for the nasal swab. And then after that, if the result come back negative, that's okay. But if it's detected positive, we will they need to see the general practitioner later.
Okay, you already answered. You already answered the question from Derima Dwi Rosmala from Karisusada Nursing Academy. Thank you for the answer. And the next question again goes to you. Came from Bernadetta from Pasar Rebo Nursing Academy. Due to the nowadays COVID-19 increase in Asia, especially in our country, it's possible that tons of people or patients will gather at ER, and it is possible that the children who come to ER cannot really be separated from other adult or maybe mother or father, because that the chance of the infected. In your very own opinion, what is the alternative solution for this problem?
The first solution that I told you, talked to you before, is that we let them call us first, whether the symptoms that happens to that child needs to come to the hospital or not. they need urgent to come to the emergency, that so they can come. But if not, they do not need to come. So that's a possibility that we can reduce the urgent visit of the ER. But if they need to come to the ER, and there are also a lot of adult patients and other adult person at the ER. As I said, that we told them trying to separate themselves to the place that separate from other adults. But they come like they have a fever, we have the guideline at the emergency unit that this is the rate. If according to triage, this is the rate per patient that we need to admit them right away, because they might get septic shock. So in this case, if they come from a rural area, we send them to get nasal swab and then separate them in a closed ward. And if they need to get admitted, and then if the negative results come back, we can admit them at the unit. But if the result come back positive, they need to be transferred to the Chakrina Libadin Institute.
Okay. Again, I think you already told before in your presentation, but maybe Estiko Maria wants to hear directly from you. Came from Pelni, Jakarta. She's asking if neuroblastoma patient is confirmed have COVID-19 and operation should be done, what should they do to wait the result come first? The result come negative first, or the patient should continue to perform the operation?
Regarding the operation, normally we can do perform on the low risk group, and if we need to do that, we need to wait for the negative result for COVID-19, because it can be wait. But normally it needs to be evaluated case by case by the oncologist also, whether this case needs to be wait or it needs to be operated right away. But normally, if we do not do the operation right away, we also have some other choice of treatment, which is the chemotherapy, as I told you before, that the chemotherapy before the surgery can be done in order to shrink the tumor size. So at the time that we are waiting for that, if the patient get COVID-19 positive, we can give them the chemotherapy first.
Okay, maybe this is the last question for you, ma'am. From Tarisa, Pasar Rebo Nursing Academy, she wants to ask you the theory of remote support. A child infected with COVID-19. Parents can have a telephone call with nurses, but how if the children have no, maybe if the children have a special needs, if there's children also they don't have parents, how to provide the support for them?
Okay, thank you very much. It's a good question. It's a very good thought that you are thinking about the child. You will be surprised that the children nowadays, they own the telephone and they use it all the time. They can use the line application. They can call the parents, and so we let them add the line with the oncology nurses or the physicians, and they can call us anytime. So I would not be surprised that if we allow them to do that also, if they need to talk to us. Or sometimes we can also call them in order to follow up about their symptoms after receiving chemotherapy. Okay.
Thank you for a wonderful answer, ma'am.
Thank you very much.
We are going to the second speaker, to Professor Dr. Farida. You have also some questions here. The first question came from Endang Puspita, Chris Husada Nursing Academy. She's asking about, should patient with lymphoma receive a vaccine for SARS-2?
I think, as I mentioned early on in the slide itself, they say any patient with any immune suppressed, they are encouraged, they are allowed to have any sort of vaccine to prevent them from getting the communicable disease.
Yeah.
All right. So there is no contraindication for people with immune suppressed. However, when they want to go for their jab, they are advised to consult their consultant or their pediatricians for any subsequent comorbidities. Unless they have some comorbidities, they have to inform the doctors, they have to inform the consultation so that they can be aware of what will be the adverse effects. Right?
Okay. Thank you, ma'am. Another
Yes.
question also goes to you. Came from Santi from Sikini Nursing Academy. She wants to ask you that you are telling before that age is the one of the cause of lymphoma. She's asking why age is to be a risk factor of lymphoma. Can you explain, please?
Again?
Why the age of the patient?
Oh, age. Okay.
Yeah.
You see, the thing is that there is some factors, like the age. We are looking at if they are the young. Remember, we said they have two different categories. So the categories of hot skin and the non-hot skins. So for those non-hot, the hot skin are more for those the younger age. All right. But this non-Hodgkin is more related to those the adult age. So when the adult age, again, what are the different factors they are looking at? Some people develop the autoimmune disease. All right. So they have some infection. They have some comorbidity. So that is one of the factors which is related to the age as well. All right. I hope that I will answer that question. But based on many articles, they say that is one of the contributing factors for the non-Hodgkin lymphoma among the adults. All right.
Okay.
For younger generation, they are more associated with the hereditary, all those on the other side.
Thank you.
Infection. Yeah.
Thank you, ma'am. Another question, ma'am, came from Bella, from Chris Husada, Nursing Academy. She's asking is, what is actually the nurse's role? How they support the patient with lymphoma in the pandemic era?
Okay, what is our nursing roles during this pandemic? I think I stress one more again. We as definitely those who are looking after the patient who is with cancer, they have a very vast experience on how to look after the patient with cancer, with all those adverse effects. So we know that what is the adverse effect for that chemotherapy. So the child maybe have a high risk of bleeding. So what are our health education for the patient, all right, for the patient as well as for the caregivers? So what are the nursing, I'm talking about the nursing health education for the patient. As I mentioned earlier on, avoid hard food. If we are talking about the sore of painful in the mouth, bleeding in the mouth. So we avoid them from having hot food, hot toothbrush. So this is also our basic nursing care. So remember, we have our basic nursing care on that. All right. Okay.
Okay.
So another thing is that we should be able to explain to the mother if they are not able to get any information. Like now we have all those telemedicine, we have all those information at our fingertips. They can always go to that information and get confirmation from the nurses who are available. I'm sure nowadays, as everybody knew, all the information at the fingertips.
Okay, again, this question goes to you, ma'am. From Ali Said, from Pasar Rebo Nursing Academy. He wants to ask you about how long does the virus stick to the surface object, like a clothes and carpet, or maybe the hard surface, like such a clothes and carpet, something like that. As your experience, as your knowledge.
Okay, I think the information, how long the COVID-19 virus or any virus can stick to all the different surfaces, I think everybody knows you can easily get from any of the website. Okay, so if like the metal, it will about 1 day, but at the cloth or any soft surface, it takes some time. So the maximum is about 5 days, 5 to 8 days, depend. So my advice is that when you have a lot of those clothes, carpets at home, okay, during this pandemic season or era, we try to put them, because I think I always back to our basic nursing before. We always like to expose them to the sun, so that you can, because it is known that all those virus will die with the exposure to the sun within how many hours, right? So please expose wherever or put it on the sun, whatever clothes or soft toys the children have after they've been used, okay? Because in the studies that I wanted to show, parents do not know that the soft toys is also part of the source of infection. They never, they clean, of course we use soap and this one, but they never clean because they thought that they overlook all those things, all right? Okay.
The next question is quite interesting, ma'am. From Cahya Utama, from Chris Husada again. He wants to ask you, what do you think about the belief that consuming ginger and garlic can increase immunity and prevent cancer?
All right. Okay. This is it also happened in Malaysia. I don't know about in Thailand, but I think it is the same because
Indonesia also.
my experience, I was in Konkan University with all the community there. So we always, the Asian always go back to our mother of nature, okay? The garlic, the cinnamon, the bunga cengkeh, all those things, and all those things.
Yeah.
So I think I believe, because we are in the community, we believe that is also part of alternative medicine. Have you heard of that alternative medicine? Yes, so
Yeah.
this is the alternative medicine which has been consumed previously. So it doesn't have any side effect that can cause you become become worse. So it is okay for you to consume the ginger and garlic, all those things, in order for you to remember, we are not talking about curing the disease. We are talking about how to reduce the symptoms, It could be other symptoms. Maybe you have the upper respiratory infection or something that you want to reduce, because to reduce the symptom, to get away of all those that bothering you. So it's okay for me. It is okay for you to consume garlic and all this, because I think there are so many studies also done by the nutritionists on what is the property of garlic, ginger, and cinnamon, bunga cengkeh, all those things. Even they said the serai or lemongrass also have some properties. They are more of how to reduce the inflammation, not to kill or not to kill all those viruses, but to reduce the inflammation, to help you to get release a bit of your symptoms. That's how no harm. But the thing is that if the condition is worse and you feel that with the cough, you have been contacted with all those people with COVID or those things, please go for further investigation and treatment. Don't just based on the garlic and whatever this is. So for your information, my student from Bandung sent me the garlic, apa itu, gula-gula ya?
Candy?
Candice, yes.
Yes.
So they sent me, they said, this is good. I said, okay, good. And based on my experience also and my observation when I was in Medina, I noticed that most of these Indonesians, they are consumed that the ginger candies for their sore throats. And it really helps them in reducing the cough, but not treating them, just reducing the cough.
Yeah,
Right?
I
So the
agree.
severity of the cough. Yes, very interesting. And I have a few of my students who are in my PhD student, he is doing this experiment between the black garlic and the normal garlic. Very interesting.
I think, okay, thank you. Thank you, ma'am. Thank you for
Yes.
the answer from the first and the second speaker. And that is the last question, I think, because many questions here, but our time is running up. As a moderator, let me give a conclusion about our topic today related to the treatment of children with neuroblastoma and lymphoma. Neuroblastoma is a type of cancer that forms in certain types of nerve tissue. Also, the symptoms maybe include bone pain, a lump in the abdomen, neck, or chest, or a painfulness, bruised lump under the skin. And then the treatment for neuroblastoma consists of surgery, chemotherapy, radiotherapy, hematopoietic stem cells transplantation. Also, the screening and treatment decision made on a case-by-case basis because there is no international guidelines yet. And the next is there are many management how to minimize the transmission of COVID-19 for the neuroblastoma patient that consists of hand washing, physical distancing from crowds, and sick people. If patient will have elective procedure or admission, patient should be free or negative from COVID-19. While the family and patient entering the ward, there are many rules that should be followed by them. And about the lymphoma is an immune cancer. There are two types of lymphoma, Hodgkin and non-Hodgkin lymphoma. The cause of lymphoma is still unknown, but there is a risk factor of lymphoma, which is consists of age, family, certain infection, autoimmune condition, and other factors. There are studies reported in the August 2020 in Saudi Arabia regarding the impact of the COVID-19 pandemic in children with cancer. There are some reasons for delaying the treatment, which is consists of hospital consolidation, limited capacity, risk of infection, swab requirement prior to admission, and current infected by the COVID. Nursing role should cut to cope the side effect the treatment. The nurse should know how to identify and reporting the side effect. Be proactive to give suggestion and intervention while side effect is happening. Okay, that is the conclusion about this session. Hopefully this material is useful for us, especially to our nursing students to improve our nursing care, especially in neuroblastoma and lymphoma patients. The committee and the 5th International Nursing Conference feel honored to have you as a speaker today and proudly present a certificate to the speaker session 1. The first certificate goes to Ms. Aucharia Patowan, PhD, RN, that will be given by Director of Cikini Nursing Academy, Nurse Yeni, Magister in Nursing and specialized in Medical Surgical Nursing.
Thank you so much.
Thank you, Ms. Patoman.
Thank you, ma'am. Okay, the next The second certificate goes to Professor Dr. Farida Muhammad Said, that will be given by Director of Pasar Rebo Nursing Academy, Nurse Iga Dewi Magister in Nursing, and specialized in pediatric nursing. Thank you, Prof. Farida.
Yeah, thank you, Ika. Thank you.
Thank you.
Yeah, hope to see you.
Yes.
All right, okay, inshallah. Come to Lincoln.
Yes, ma'am. Okay, ladies and gentlemen, please give a big applause to both speakers and our directors.
Thank you.
Thank you. Coming next, we are going to have our second session. Our third speaker is from Indonesia, our country. She is Dr. Aleni Dekania, Bachelor in Nursing, Master of Science. Her topic today is the treatment of children with leukemia in the COVID-19 era. I would like to apologize first, ma'am, for not being able to read your whole CV. I will read the CV of hers. Dr. Aleni Dekania, Bachelor in Nursing, Master of Science. Currently, she held the position as the Chief Administration of Department of Health Science, University of Indonesia. Her experience as a lecturer and also as the second Vice Dean of General Administration, and the latest one is the Finance Coordinator, Department of Health Science, University of Indonesia from 2015 till 2017. She has various research also, but her latest research was about the effect of music therapy on sleep quality among children with chronic illness. She also a part of many organizations, including the Indonesian National Nurses Association, Association of Indonesian Nursing Education Institution, Indonesian Nurses Manager Association, Indonesian Pediatric Nurses Association, and the Indonesian Nursing College Association. Again, I remind to all participants, you are welcome to send the question on the chat room while the speaker is presenting the material. Dr. Aleni Dekania, you have 30 minutes to deliver your speech, ma'am. To Dr. Aleni Dekania, time is yours.
Thank you very much for the moderator.
Thank you.
Thank you very much for introducing me, and it is great honor for me to be the speaker in this great conference. I would like to share my slide. Yeah, is that okay?
Yes, ma'am.
Yeah, what about my sound? It's clear enough?
Clear enough.
Okay, thank you. Yeah, thank you very much for the previous speakers. It's help me in introduce the pediatric cancer care during the pandemic era, because some information is quite similar. So in this session, I will share about the leukemia treatment in the COVID-19 pandemic era. Yeah, I focus in this research interest because the moderator have introduced me enough. So my research interest is chronic illness in children, symptom management in cancer, pediatric palliative care, children with quality of life, family empowerment of children with chronic illness. I work together with students from Magister for pediatric and specialist nurse pediatric also. So I welcome you when we can doing research together or writing the journal together about the chronic illness. So for this presentation, I will answer three big questions here. What are the impact of COVID-19 to the pediatric cancer centers and patients? How do cancer centers provide anti-cancer therapy safely in children with cancer? And what is the role of telehealth medicine? Every year, estimated 263,000 new cases of cancer affect children under the age of 20 years old worldwide. It means that every day we found new kids affected by cancer, around 720. It's very, very huge. And for Indonesia, every year predicted 11,000 new cases of cancer identified. And every day, approximately 250 kids around the world die from cancer. It means that almost 100,000 children with cancer lost their life. Yeah. This is a cancer patient journey. As you can see that cancer patients is grouping in chronic illness. Chronic illness means the disease which need more than 3 months healthcare providing healthcare services. So a cancer patient journey, it's cancer patient journey is one of the chronic illness. So since patient experience symptom identified and seek for help from the medical or hospital, maybe symptoms identified is quite long, not very acute symptoms, but maybe gradual symptoms. And when the diagnosis established using many procedures identified, and the treatment choice and protocols as for children, either oral or infused or invasive therapy, then children get therapy cycles and regimen change for few months or years until they survive or the disease progression because the therapy not respond well. So along with cancer patient journey, there is many health professional interact with children and parents, nurse, GP, nurse, oncologist. Yeah, during diagnosis, the patient meet nurse, oncologist, pathologist, radiologist, and during the therapy cycles, nurse, oncologist, surgeon, and as well as pediatricians, pharmacists, nutritionists, until at the end of this care, nurse is a very important role to involve in the cancer patient journey. So leukemia is the most common type of cancer in children. All cancer begin in cell of human body like retinoblastoma, lymphoma Hodgkin's, neuroblastoma. But leukemia is a cancer that begins in blood cells. In Indonesia, we call kanker darah. Normally, human cells grow and multiply to form new cells as body needs them. But in leukemia, the type of cancer found in human blood and bone marrow characterized by abnormal increase of blood cells, usually leukocytes, white blood cells. So leukemia is the most common malignant neoplasm in children, around 31% for the epidemiology, and 41% of malignancies occurs under 15 years old. So this is among leukemia. The acute leukemia, acute lymphoblastic leukemia is the highest incident, and peak incident in children from age 3 to 6 years, more common in boys than girls. And until now, the certain causes is not now. Yeah, this is 31% for the incidence among the others cancer, and this is for survival rate. This data is represent the developed countries. Yeah, developed countries. However, in developing countries, we still struggle to achieve this 5-year survival rate. Indonesians using 2 years survival rates, not so aggressive to achieve the 5-year survival rate. So the causes and risk factors comes from the environment, such as infections, the viral, bacteria, fungi, radiations, chemical exposure, as well as internal factors such as previous chemotherapy received by children or parents, mothers, and genetic conditions such as syndrome Down, race, Hispanic is quite a lot incidents compared to other race, and smoking behavior. Diagnostic tests to establish leukemia, at least we conduct five steps: physical examinations, blood tests, complete blood count, bone marrow aspiration or biopsy, cytogenetic and spinal tap, and risk stratification of childhood leukemia based on National Cancer Institutions. A standard risk when ILL happen in children under 10 years, and white blood count under 50,000 cubic microliter, yes. And high risk ILL when the child get the ILL more than 10 years, and white blood cell more than 50,000 cubic microliter. This is biopsy or bone marrow puncture. This is spinal tap in Indonesia, or medical term is lumbar punctions to get the cerebrospinal fluid and blood test. Yeah, this is the pictures. Yeah, when in peripheral blood smear in leukemia like this, and in the bone marrow like this. So what kind of leukemia symptoms? Easy bleeding, yeah, severe infection because very child get frequent viral infections, and painless swollen lymph nodes, and bone pain, and red spot on skins, and weight loss. Some of them after suffer for a long time, enlargement of hepatomegaly, hepatomegaly and splenomegaly. This is the treatment for leukemia. Mostly chemotherapy combination is the choice, and radiation therapy when cancer cells were found in CSF, cerebrospinal fluids. So to prevent the cells of cancer enter to the brain info, and stem cell transplant choice after remission in induction phase, especially for high risk ALL, or target therapy rare in children because in adult only. So the routes for chemotherapy is intrathecal, direct to the using lumbal punctures, and infusion, either peripheral or central access vein, and oral. This is the three phases standard of chemotherapy: induction phase, consolidation, and maintenance. Some of patients maybe get relapse or recurrent ILL, so that because not good response in chemotherapy in induction phase, so the doctor rearrange the chemotherapy using aggressive chemo. And the length of therapy among 2 or 3 years depend on the patient response. This is the normal sequence before the pandemic era. Side effects of chemotherapy, the previous speakers already mentioned many things, side effects that children experience, such as nausea and vomiting, mucositis, diarrhea or constipations, yeah, fatigue, and so on. And every side effect should be informed to the patients and the parents need educated to manage the symptoms. This is nursing diagnosis, the example: risk for infection, risk for hemorrhage, fatigue, imbalanced nutrition, risk for ineffective family therapeutic regimen management because of fear of death and recurrent hospitalizations. This is nursing priorities. Every patient comes to the hospital, nurse to prevent infections, maintaining circulation blood volume, alleviate pain, fatigue, other side effects, promote optimal physical functioning, provide psychological support and comfort, and provide information about disease, process, prognosis, and treatment needs. This is an example of nursing intervention. We do independent intervention as well as collaborative interventions. So, what the impact of COVID-19 on pediatric cancer care? Professor Farida already mentioned, and Dr. Ocharia already explained about the impact to pediatric cancer care. So, I think it's almost similar with me. This research from Poem Group that identified 34 centers from 19 countries who participate in this cancer research stated that almost centers develop guidelines to optimize resource utilization and safety, including delaying of treatment visit, rotating and reducing staff, implementing social distancing, hand hygiene measures, and personal protective equipment use. Up to 45% they do essential treatment delay for chemotherapy, surgery, and radiation therapy, and they do also restricted acceptance of new patients, and this is clinical care delivery was reported negatively affected. So shortage in blood products is complained by feeling experienced by 70% of centers, and up to 65% interruption in surgery and radiation, as well as medication shortage. Yeah, so shortage for blood product and medication is the reason to delay the therapy. This is continue for the study, the same study, effect of on medical staffing resource. We can see that decrease in admin support is the reason why the limitations of services, because this is also doctors and nurses decreases due to rotation staff schedules, and mostly staff working from home. For treatment resources, we can see that blood product shortage, surgery delays, and decrease in social services supports like uh, uh, relawan namanya. Yeah, limited volunteers that come to the hospital company children to playing together, learning together, and something like that. And especially this is radiation therapy delays too. Policy changes related to pediatric oncology. The two reason is because of lockdown and visit restrictions for radiotherapy or röntgens from outside hospitals. And this is happen that pencil cancellations of therapy visits. 22 centers experienced that. American Cancer Society survey for cancer and cancer patient and survivor. Up to 80% patients stated delays in their healthcare. Delay in cancer therapy, change to in-person cancer provider appointment, delay in access to imaging services, and delay in surgical procedures. 20% experience delay access to supportive services like physical therapy and mental health care. This is a survey from parents. 55 parents explain that they face for transportation's problem in almost 100%, financial burden 96%, and loss of job 64%. And mostly they fear to contracting COVID-19 infection. It's become primary barrier in seeking treatment for most respondents. This is the explanation about previous research. So cancer patients and COVID, yeah, we already heard from the previous speakers that the conditions patients immunocompromised conditions because of cancer and cancer therapy decrease the patient immune system, and cancer patients have twice the risk of being infected COVID-19 compared to general populations. In cancer patients, severe symptoms COVID-19 will appear 4 times faster than patients without cancer. So patients who travel between regions, cities, provinces for treatment have higher potential for the spread of COVID-19. This is a risk factor. Patient with cancer infected by COVID-19 because of patients is leukemia, lymphoma, and myeloma, and taking immunosuppressive agents, underwent bone marrow therapy in the last 6 months, undergoing chemotherapy, receive radiotherapy intensive, and leukopenia patients. This is data from Darmais Cancer Hospital, referral for cancer hospital. For children incidents, last year during 10 months 2020, that hospital found 6 children who get infected by COVID-19. But in 2021, only during 2 months, the hospital get 5 children infected by COVID-19. I don't know the numbers until now. Maybe increasing numbers children with cancer contacted or infected by COVID-19. This is only from Darmais Hospital. We have around 400 cancer centers around Indonesia. So could be hundreds of incidents of children with cancer infected by COVID-19.
I apologize, ma'am, to interrupt you, but you have 2 minutes left.
2 minutes, okay. Yeah, screening. Screening, thank you. It becomes an important requirement for patient before undergoing therapy. This is the goal of screening, separating patients, yeah, with suspected COVID-19 from non-COVID-19 until ensuring the use of PPE follow the guideline, PPE level 1, level 2, level 3. Yeah, and this is the regulation of screening or the guideline of screening state from Ministry of Health. I think is internationally strict screening step for the patient and visitors who comes to the hospitals, especially the patient wants to get the therapy. And this is the algorithm of screening. Yeah, when patient comes to the outpatient apartment or patient comes to inpatients. When the children get no clinical manifestation, that normal procedures being done by the health professional. In zone 2, when children get infected, yeah, so children transfer to COVID care. This is flowchart from Cipto Mangunkusumo Hospital is quite similar with the Thailand and Malaysia for the step-by-step and the guideline. And this is for the children with leukemia flowchart for the non-designated hospital experience. It means that this hospital is not COVID-19 hospitals. This is a general hospital or cancer care hospital. The focus on testing, tracing, treatment is very important. So I come to this is our campaign, yeah, 5M. Telemedicine benefits efficient way to receive initial care and perform triaging, screening for COVID-19 symptoms. So before patient comes to the hospital, using telehealth, and this is liaison with peripheral hospital to save time and cost on care delivery locally. Means that patients can use the peripheral hospital to during lockdown. However, there's challenging using telehealth. This is support emotional is not enough, adequate. Different in literacy of information technology among patient and family, and limited money for internet, and not every household has good quality camera. When the telemedicine need interaction with family and doctors and need to show maybe the symptoms like not good quality camera, it's reduce the effectiveness of the telehealth. For the health care, health professional, doctors and nursing who conduct telehealth medicine, there's because informal consultation happen in during telehealth medicine, that telemedicine has not set up as a system at the hospital for the moment, so the doctors and nurses cannot get reimbursement. Two more slides. This is a shelter rumah singgah shelter or rumah singgah that mostly patients around Jakarta need rumah singgah or shelter home to stay for a while after being between the cycles of chemo. So the shelters develop regulation also for the prevention COVID-19 pandemic involve parent and children asked to screen for COVID-19 at the hospital. Test results are informed to the shelter, and children and parents carry out self-isolation for 3 days before they interact with other shelter residents. It means that before pandemic, the parents and children comes to the shelter 1 day before the chemotherapy, and right now at least 3 days or 5 days before the chemotherapy, so before go to the hospital. This is survivors declare plan. This is the issue of consequences of delay comes to the screening process. Yeah, for patient and parents come to the hospital either for OPD visit, emergency, pro chemo, pro surgery, and parents accompany child. They have to screen. They have to get screening antigen or PCR. And when positive, postpone the chemotherapy and suspect 4 days self-isolation. Negative chemotherapy, any procedure can be conducted. And parents must test, retest rapid antigen every 7 days hospitalization. Parents who get COVID before have to test the PCR, not rapid antigen. So I think for the protocol, which is range for 2 years, it become longer because of these procedures that can be done every single patient and parents come to the hospital to get the service. So this is dilemma because hospital want to provide anti-cancer therapy safely. However, they experience the screening every time prior therapy becomes stressful for children and parents. This is the last slide. Yeah, thank you very much.
Okay, thank you, ma'am, for the nice explanation. Actually, we will start again to another speaker, but seems that our last speaker is not here yet. We will just continue with the discussion session. Is it possible?
Yes.
Possible. Okay. The first question came from Fitriani from Chris Husada Nursing Academy. She wants to ask you why race is included as a cause or a risk factor for leukemia. Race is included as a cause or a risk factor for leukemia.
Yeah, this is epidemiology factors. Yeah, this is epidemiology factors that study for a race in around the world. That the researcher or epidemiologists found that the race contribute, not the costing. That it is the risk factor to have a child with leukemia. That's yeah.
Okay, thank you.
Research.
Thank you, ma'am. The another question from Endang from Chris Husada. Maybe she is asking about this. Actually, I don't understand with the question. Maybe something like this. Maybe she is asking about the effective prevention. What's the effective prevention So we can to avoid the leukemia for children. What is the effective prevention so we can avoid the leukemia for children?
Okay. I'm not sure for the question, but for the risk factors, maybe the control of. Can you hear me? Because
Yes, ma'am.
it's
Yes, ma'am.
azan.
Yes, ma'am.
Yeah. Actually, the leukemia is unknown. The causes of leukemia is unknown. The leukemia can develop in embryonal phases during the pregnancy. Yeah.
Yes.
And leukemia for cannot be prevented, but can be treatment. That's the slogan. The the patient cancer in pediatric cannot be prevented, but hopefully can be treatment effectively. So to improve the survival rate is our goal.
Okay, ma'am. Thank you. Thank you for the answer. Another question from Ifori, Pasar Rebo Nursing Academy. She's telling that the symptom of COVID-19 and ELL, acute lymphoblastic leukemia in children almost have the same, such as fatigue, weakness, and dizziness. Also, shortness of breath and pale skin. The question is how we can specify that the differentiation between the COVID patient and with the leukemia in children.
Okay. The side effect of cancer and cancer therapy is already proved before the COVID-19. Yeah. So the patients experience fatigue, weakness, dizziness, short of breath, and pale skin happen because of the lower immune system of patients, and the metabolism change because of chemotherapy, high dose infused or giving to the patients. So that's the condition. So patients in the states of immunocompromise.
Yes.
Yeah, very low defense of body defense. For COVID-19, the side effects of the symptoms of COVID-19 is similar because of not patient not get the chemotherapy. Yeah, patient not get chemotherapy. However, patients cancer who get chemotherapy prior chemotherapy and after that get the COVID-19 maybe experience similar conditions. However, the cause of symptoms is different.
Okay, thank you, ma'am, for the answer. I hope the person who asked the question understood well. Maybe also you can mix with the Indonesian language, so maybe
Yeah.
they will know. And the next question came from Nursia, again, Kerisusada Nursing Academy. She's asking, what is the best education in the environment and in the hospital for leukemia patient? So she's asking for what is the best education. And the second is what is the habit can be done so we can control the, what's that? We can control the children with the leukemia, I think. What is the habit? The habit so we can do for the patient with the leukemia.
Ya, in bahasa Indonesia ya.
Of course, ma'am.
Ya, anak dengan kanker sudah terbiasa melakukan protokol kesehatan karena dia sudah tahu bahwa dirinya sedang berada dalam kondisi imun yang rendah. Ya, orang tua juga demikian. Kalau anaknya sedang habis terapi, habis kemoterapi, maka orang tua secara otomatis membatasi interaksi. Jadi kayak social distancing. Ya, menjaga jarak, social distancing, membatasi interaksi dengan pasien lain atau orang tua, semata untuk mempertahankan imun anak supaya tidak makin rendah. So during COVID-19, I think the perilaku itu tidak berubah buat mereka, malah makin ketat gitu ya. Jadi menguntungkan bagi anak-anak dan orang tua kondisi ini sebenarnya. Cuma yang membuat stres adalah screening tadi. Perasaan deg-degan kalau masuk rumah sakit harus di screening, positif nggak ya gitu. Karena tujuannya datang ke rumah sakit udah jauh dari tempat, dari terbang, dari provinsi lain gitu, dapat pengobatan, tapi ternyata yaitu pintu gerbangnya di screening tadi. Dia boleh lanjut terapi atau harus isolasi lagi, atau malah dia dapat COVID, terinfeksi COVID selama perjalanan seperti itu.
Okay.
Ya, jadi seperti itu. Ya.
Thank you, ma'am. We have many questions here. I hope you can answer all of them. Came from Laura Gabriel from Sikini Nursing Academy. She is asking about, because you told before on your slide, what is the reason of not giving a patient a fresh fruit for leukemia patient? And also, what is the reason for not placing a cut flower on patient's room?
Oh ya, Indonesia also.
Okay.
Buah dan bunga itu adalah bahan hidup ya, bahan yang segar.
Yes.
Jika tidak dimasukkan ke dalam lemari pendingin, maka dia akan memanggil serangga. Jadi bisa lalat buah, ya, yang bisa menjadi mediator buat terjadinya infeksi pada pasien dengan kanker. Jadi kalau mau bawa buah, maka buahnya itu harus disimpan di dalam lemari pendingin untuk mencegah timbulnya lalat buah seperti itu. Jadi,
Okay, ma'am. I think they should understand what is the meaning of that, because already in Indonesia.
Yeah.
Another question is from Nuri from Pelni Nursing Academy. The question is, for children who have leukemia and are confirmed positive for COVID-19, what about the chemotherapy? Do you have a special drug such vaccines, or they should avoid the chemotherapy first?
Okay. Yeah, for children who infected by COVID-19, they have to transfer to COVID area nursing care first until they get negative PCR twice. Jadi harus 2 kali PCR negatif baru boleh dia melanjutkan kemoterapi. Jadi kemoterapinya sementara postpone, ditunda, hold. Ya. Untuk vaksin pada anak-anak kita masih menunggu dari pemerintah. Kalau dari studi, dari penjelasan pembicara sebelumnya, vaksin pada anak dengan kanker dibolehkan sejauh tadi imunokompromisnya sudah teratasi. Sebenarnya itu karena vaksin reaction salah satunya adalah men-trigger daya imun anak ya. Jadi terhadap vaksin yang masuk ke tubuhnya. Jadi kalau misalnya status imunnya masih rendah itu tidak disarankan untuk vaksin.
Okay, ma'am. Thank you. We have question here came from Indian nursing student.
Okay.
From Gokularis Khan. She or he, I'm not sure, she or he is asking about what are the post-COVID-19 lifestyle changes, complication, and intervention for the children with leukemia.
Yeah. The main lifestyle changes is screening for get therapy. Yeah, it's very stressful for children as well as for parents. Screening itself, parents pay by themselves. So it's about finance. It's about money. So yeah, it's difficult for patients who lost jobs. Yeah, parents who has lost jobs and no insurance coverage is very hard for them. The lifestyles for the COVID prevention, like using mask, wash hand, and social distancing, I think is not only for patients but only for us too. Yeah, and the complications is side effects. Yeah, side effects of therapy can lower the immune system, such as patients who experience nausea and vomiting. Yeah, no meals at all can decrease the immune system. And based on my research, 50% of children with cancer come to the hospital to ER emergency room between cycles. It means that unplanned visit because of the side effect management is not effective during they stay at home. I hope they clear.
Okay, thank you, ma'am. Thank you for the answer. I hope the student from India also can understand.
I think enough, yeah.
Yes, for a while, please. Okay, we are moving to the next session. The committee will send a certificate. The committee will give certificate to the speaker came from Indonesia. The certificate will be given by Director of Keris Husada Nursing Academy, Nurse Tati Setiarini, Bachelor of Nursing, Master of Public Health. Hello.
Thank you, Ibu.
Thank you, Ibu. Thank you. Terima kasih. We are waiting for our last speaker from India. I will read the CV of hers first. She is Professor Dr. A. Jaya Suda, Master of Science, PhD, RN, RM. Her topic today is the treatment of children with osteosarcoma in COVID-19 pandemic era. I hope she is already in our chat room or in our Zoom. I would like to apologize not being able to read the whole CV of hers. Professor Dr. A. Jayasuda, Master of Science, PhD, RN, RM. Currently, she held the position as the principal, PSG College of Nursing, Coimbatore, India. She is a doctorate in obstetric and gynecological nursing. She has 28 years of teaching experience in the field of nursing and had been handling subjects like research in many fields like OB/GYN nursing, nursing management, nursing education, foundation of nursing, critical care nursing, emergency and critical care nursing, medical surgical nursing 1 and 2. Thus far, she has organized and participated and presented papers in more than 60 conferences, both nationally and internationally, conducted also more than 20 seminars for staff nurses of government hospital and PSG hospital and corporation maternity center staff. She is the examination panel member for Basic Science and Master of Science, and with the Tamil Nadu Dr. MGR Medical University and many universities. She is also the recipient of Rula International Distinguished Researcher Award of the year 2020. Also the Best Teacher Award by the Tamil Nadu Dr. MGR Medical University, Chennai. Also, the Best Nurse Educator Award from Education Today magazine at Chennai. Also, the President of GCI, Junior Chamber International, Salem Gokulam of the year 2010 and 2011. Also, the last is the Best Participant Award at the Effective Public Speaking, Training and Nursing Excellence Award. To Professor Dr. A. Jayasuda, are you with us already? Because of something happened, I return back the event to the MC, so the MC can lead the event. Thank you. We will see the company profile of our nursing academy.
Selamat datang di Akademi Keperawatan Pasar Rebo. Yuk kita lihat fasilitasnya.
Selamat datang.
Aku biasa ke perpustakaan ini untuk mencari referensi. Yuk, masuk. Sekarang kita ke lantai 2 yuk untuk melihat laboratorium yang ada di sini. Yuk, masuk. Sekarang kita ke lab selanjutnya yuk. Nah, yang terakhir ada keperawatan jiwa. Yuk masuk. Nah, itu dia fasilitas yang ada di Akper Pasar Rebo. Aku tunggu kamu di kampusku ya. Dadah.
Selamat datang di Akademi Keperawatan Pelni, Jakarta. tempat kuliah keperawatan terbaik dengan fasilitas dan mutu yang terstandar. Dengan sistem pengajaran yang profesional, Akademi Keperawatan Pelni Jakarta siap menghasilkan tenaga keperawatan yang berkualitas. Berbagai fasilitas telah kami lengkapi sesuai kebutuhan.
Thank you to moderator and all the speakers who have given us such wonderful materials and insight about how to giving treatment of children with cancer in COVID-19 pandemic era.
Terima kasih kepada moderator dan semua pembicara yang telah memberikan kita materi yang sangat luar biasa tentang perawatan anak dengan kanker pada era pandemi COVID-19.
Ladies and gentlemen, again, let's give a big appreciation to all the speaker and our moderator.
Para hadirin sekalian, sekali lagi mari kita berikan apresiasi kepada para pembicara kita.
Ladies and gentlemen, we are going to the next agenda, which is oral presentation session. And our moderator is Eltania Giovanni, nursing assistant. To Eltania, come to join us and I hand over this agenda to you.
Selanjutnya kita akan memasuki acara berikutnya, yaitu sesi oral presentasi. Moderator kita yang akan memimpin oral presentasi ini adalah Eltania Giovanni, ahli media keperawatan. Kepada Eltania dipersilakan.
Thank you for the master of the ceremony. I would like to introduce myself again. My name is Eltania Giovanni. I'm from Nursing Academy of CCI Cikini. I should say it's quite an honor for me to be able to lead this oral presentation as a moderator. Before we start with our oral presentation, I would like to introduce our speakers. As for today, we have 7 speakers in total. These 7 speakers are not only going to give us a presentation, each of their own, but they are also going to represent their own institution. And for the institution which will be represented by our speaker are namely the Nursing Academy of Karisusada, the Nursing Academy of Pasar Rebo, and the Nursing Academy of CCI Cikini. Now, from Nursing Academy of Karisusada, we have 3 speakers. The first speaker is Mr. Sumrahadi, Master of Public Health. He's going to give us a presentation about the level of academic burnout among nursing students during COVID-19 pandemic. And the second speaker is Ms. Eni Sumartini, Magister of Nursing, and for the presentation she's going to give us is about the phenomenological study of the experience of parents who have children with stunting. And the third speaker is Ms. Yulianti, Magister of Nursing, who's going to give us a presentation about the effect of psychoeducational intervention for caregivers burnout of client schizophrenia. And that's our speaker from Nursing Academy of Karisusada. Moving on next, from Nursing Academy of Pasar Rebo, we have 2 speakers. The first speaker is Nurse Sri Nyumira, Magister of Nursing, Specialist in Psychiatric Nursing. And she is going to give us a presentation about a literature review, which will talk about the psychological impact on health workers during the COVID-19 pandemic. The second speaker is Nurse Yuanita Panma, Magister of Nursing, Specialist in Medical Surgical Nursing. And she's also going to give us a presentation about a literature review regarding the factors which affecting COVID-19 vaccination acceptance in general population. And that's our speakers from Nursing Academy of Pasar Rebo. Now, for the last but not least, from Nursing Academy of CCI Cikini, we also have 2 speakers. The first speaker is Nurse Linja Siringo-Ringo, Magister of Nursing, Specialist in Pediatric Nursing, who's going to give us a presentation about sleep quality among nursing students during COVID-19 pandemic. And the second speaker is Nurse Santa Maria Pangaribuan, Bachelor of Nursing, Master of Science, and she's also going to give us a presentation about the relationship between parenting style and stress for parents during the COVID-19 pandemic in Bojong Sari, Depok. And that's everyone, our 7th speaker for today's oral presentation. Before we start, I would like to remind you, if you have any question, please wait until the end of the session to give your question, because at the end of our session, we will have a discussion session. In those sessions, we will allow you to give you a question to the speaker, or if you feel like you may forgot your question later, you can type down your question using Zoom chat box. Or if you are watching this conference from YouTube, you may use the comment section to type down your question. And as for the speakers, we will give you 15 minutes to deliver your presentation. Now, without further ado, let's start our oral presentation. Okay.
Hello, Professor Dr. Jayasuda, are you with us already, ma'am? Hello?
Unmute.
Hello, Professor Dr. Jayasuda, are you
Yes,
with us?
good morning. Good morning to one and all. I'm extremely sorry. Extremely sorry for the technical issues and the network problem.
Yes, ma'am. Acceptable. Acceptable, ma'am.
So my apologies to all the delegates and the host.
Okay, ma'am. It's okay.
Can I share my screen?
We will continue. Your topic today is the treatment of children with osteosarcoma in the COVID-19 pandemic era. You have 30 minutes, ma'am, to deliver your speech, and now time is yours.
Thank you so much. I extend my apologies to all the organizers and the delegates waiting for me, and my grateful thankfulness to the organizers and Professor Reza for having given this opportunity. Today I'm going to talk about treatment of children with the osteosarcoma during COVID-19 pandemic era. As we knew that the novel coronavirus, COVID-19, which is caused by a severe acute respiratory syndrome, has been declared globally by the World Health Organization on 11th of March. In the past week, when I reviewed the COVID-19 cases and the deaths continue to decrease now, with over 2.6 million new cases, 72,000 new deaths reported globally. While the number of cases reported globally now exceeds more than 175 million. In India, with a population of more than 1.3 billion, the number infected is 67,208 new cases every day. Around 30 lakhs been confirmed cases, and there have been more than 38 lakhs deaths as on 16th June, the last week. With the rising number of infections and mortality in India, the healthcare sector has to be set forth to deliver the optimal care. So during this COVID-19, the people with cancer are receiving the treatment for cancer. They are at enhanced risk of serious morbidity, including the need for ventilator support or the increased risk for mortality. This is because of their immunocompromised state caused not only by the malignancy, but also by the anti-cancer therapies. So in the beginning, there is a paucity of data and the guidelines in managing the musculoskeletal tumors, that is osteosarcoma, during the COVID-19 pandemic, and which does not reflect the situation in a resource-constrained settings like India. So that study conducted by Ashish et al. Aimed to provide guidance to the healthcare professionals involved in the management of sarcomas to adapt to the situation, optimize the treatment protocols with the judicious use of all the resources like manpower, operation theatre, intensive care unit, essential drugs, blood products, while maintaining the highest standards of evidence-based treatment. In globally, when we see that osteosarcoma is the most common primary malignant bone tumor in children and adolescents, which accounts for 4% of all childhood cancers. I'm sure from morning, 3 of the speakers before me have spoken about different cancers like lymphoma, neuroblastoma, and leukemia. So in India, the incidence varies from 4.7 to 11.6%, where this malignancy is associated with significant morbidity and mortality. This osteogenic sarcoma was found to be the most common bone sarcoma, according to the survey which has been done. The incidence, as we see, that it is more prevalent in males than female. It involves any age, but highest in 12 to 25 years of age. So can we just recap what is osteosarcoma? As we knew that osteo means it's a bone or the osseous tissue. Sarcoma is a malignant tumor of the connective tissue. That is what osteosarcoma, the tumor of the osseous tissue in the bone. So what is this osteosarcoma? It is a highly malignant tumor arising from the primitive mesenchymal bone, forming the cells, and otherwise it has been called as osteogenic sarcoma. So mainly it has been distributed skeletally in the femur, proximal tibia, proximal humerus, sites of rapid bone growth, and other areas are metaphyseal, diaphyseal, and epiphyseal. And here is the distribution, how it has been distributed in the bone. Where in the humerus, femur, tibia, and this. So most of the time we see that it may be because of the hereditary, why the person may get this osteogenic sarcoma. It may be a hereditary retinoblastoma or associated with any other syndrome, Bloom's or Werner syndromes. It may be due to the post-irradiation. Osteosarcoma is the most frequent cancer which occurs during the first 20 years following a radiation therapy for a solid malignant tumor in childhood. And due to the Paget disease, which is a transformation into osteosarcoma because of this disease, which usually present in adults in the 5th or 6th decades of life. So according to WHO, they classify this bone sarcoma as low grade, intermediate, and high grade and variable grading. What is this low grade? Low grade central osteosarcoma, periosteal osteosarcoma, clear cell chondrosarcoma. Intermediate is periosteal osteosarcoma, and high grade is where Ewing sarcoma is there, mesenchymal chondrosarcoma, differentiated chondroma, poorly differentiated chondroma, angiosarcoma. There are different varieties are there in bone sarcoma itself. And it varies from 1 to 3 grades according to the events. And also we have leiomyosarcoma. So when we say in a simple way how we can classify this, it can be a primary or secondary. Primary osteosarcomas, which usually occurs between 15 to 25 years of age, which is a conventional or classic osteosarcoma. It is because of intramedullary, low-grade intramedullary osteosarcoma, which may affect periosteal region, and periosteal osteosarcoma, high-grade surface, telangiectasis osteosarcoma, and small cell osteosarcoma. And secondary osteosarcomas, which are at the site of the another disease process. Because of the other disease, the person may go in for the osteosarcoma. More common in there, more than 50 years of age. Most commonly, we can say that it's a pre-malignant condition like Paget's disease. If the person has been exposed to the radiation therapy because of the cancer like leukemia or neuroblastoma or any disease, radiation therapy, or endochondromatosis, fibrous dysplasia, osteochondroma, and osteogenesis imperfecta. So usually the conventional one, it begins with the intramedullary location. From there, it breaks through the cortex and which forms a soft tissue mass. And histologically, when we see that osteoblastic or fibroblastic and chondroblastic sarcoma is seen. And osteoid production is from the tumor cells. And that stands for high-grade spindle cell component. So what are the clinical presentation the child may have with the osteosarcoma? Yes, the child may have a progressive pain, particularly with the activities. Severe pain will be there. And also where we can see the swelling. If you see here in this picture, which I have shown you, palpable mass in the region of metaphysis, skin over the swelling, if you see, it is very shiny with the prominent veins. You can see the veins are very prominent. The swelling is warm and tender. Because of that, the person will have a decreased range of motion with the involved joint, lymphadenopathy, which is unusual focal and regional lymph node involvement, and the respiratory finding will be in the late stage with the lung metastasis. So what are this one when we see the pathophysiology, the osteosarcoma predisposing risk factors may be due to the growth related, somatic alteration, germline genetics, and the environmental factors, which all will say the osteoblastic DNA mutation. So this DNA mutation, when there is an activation of oncogene, deactivation of tumor suppression genes. What happened? This will proliferate the malignant osteoblast. From there, it forms the osteoid tissue, overcrowding of the osteoid tissue in the bone, which suppress the bone marrow, decrease the production of blood cells. Also, cancer cell metastasis occurs because of the overcrowding osteoid tissue in the bone, which interact with the different organs, not only in the bone, it starts interacting with the other organs affecting. Then also there is increased pressure in the bone, which causes pain, swelling, and fracture. This is the pathophysiology of osteosarcoma. I'm sure you are clear with that. What are the investigations which has been done? Radiological examination, that is they take a plain X-ray, MRI, bone scan, and also biopsy has been taken and angiogram. So there is a Codman's triangle sunburst appearance. If you see here, this bone here, we have the appearance of this, it's called as sunburst. When the sun bursts, how does it look? The same way, it is the periosteal reaction. The other one is a Codman's triangle. See that it looks like a triangle one, which I can say that it is a term which we use to describe the triangular area of the subperiorbital periosteal bone, which is created when the lesion or often a tumor rises from the periosteum away from the bone. That is what we call it as a Codman triangle. Okay. So Codman triangle, the typical symptoms where you can see is Codman triangle and sunburst appearance. So what are the other laboratory studies other than this? This has been done is full blood count, ESR, LDH, platelet count, electrolyte levels, liver function test, and the renal function test. Okay. So how are we going to manage during COVID-19 the children with the osteosarcoma? I'm sure Dr. Acharya has explained in detail about the management during COVID of each one, like chemotherapy, radiation therapy, and also when the person goes in for the surgery. So in a nutshell, I can summarize, because always it is easy for the last speaker to speak. All three speakers have covered elaborately the points to be discussed with the cancer. So particularly for the osteosarcoma, when a child comes to the OPDs during this COVID-19, we need to schedule the OPD appointments only for emergency cases. Others to be scheduled through teleconsultation. And whenever we want to have an appointment or the treatment, prioritize the case as a low priority, medium, and high, based on the symptoms and the treatment. So both the patients and the healthcare team need to take a precaution such as wearing a mask, sanitizing, using a PPE with appropriate social distance. So this is the management for the osteosarcoma, having stem cell therapy, radiofrequency ablation, gene therapy, immunity therapy, molecular dark matter therapy, radiation therapy, chemotherapy, and surgical resection. These are the management of a child with the osteosarcoma. So the chemotherapy, the most common drug which has been used for the osteosarcoma is a methotrexate with leucovorin folinic acid, that is doxorubicin, cisplatin, etoposide, cyclophosphamide, actinomycin, and bleomycin. So when I refer the journal, they say that non-methotrexate based mutated chemotherapy regimes seems to be economic and as efficacious as methotrexate based chemotherapy in osteogenic sarcoma, with a less complex pharmacokinetic monitoring and acceptable toxicity as per the studies from the AIMS and which has been published in the Asian Journal of Cancer. Radiation therapy, which may be useful in some cases where the tumor cannot be completely removed by the surgery. So in a recent study, using MRI and clinical findings as the alternate parameters to evaluate response to patients with the tumor in patients, 12 to 14 patients with the osteogenic sarcoma, observed that both dynamic MRI slope as well clinical indicators such as change in pain, tumor girth, maximum tumor diameter response. Immunotherapy, portion of the tumor is implanted in the sarcoma survivor, which has been removed after 14 days. So the sensitized lymphocytes from the survivor are infused into the patient, and these cells selectively kill the cancer cells. And next treatment is the surgery. The main goal of surgery is to safely and completely remove the tumor where it is. Limb salvage surgery, we call it as removing the tumor with a wide margin of normal tissue surrounding it, while preserving the vascular and nerve supply to the extremity. That should be taken care. So what are the principles we follow during this pandemic when they do the surgery? Adequate PPE and surgical and anesthesia consideration should be followed to minimize the risk of COVID-19 transmission. And curative surgery for locally aggressive and low-grade sarcomas can be delayed. Not necessarily we need to do. It's not urgent. Palliative surgeries for sarcoma should be avoided during COVID-19 pandemic, and alternative non-invasive options must be explored for the patients. For sarcomas with the metastasis, therapy. In proven or highly suspected COVID positive patients, all sarcoma treatment, including surgery, should be delayed until 15 days. That is during an incubation period, or recovery from the symptoms of the patient turning seronegative, whichever is later, that treatment should be postponed. So what is our nurse's role here? So we need to care following the education after the each cycle of chemotherapy, post-operative and long-term care after limb-sparing surgeries. They say that during this COVID-19 chemotherapy, what are the things can be done? Use a shorter regime to avoid a hospital stay, and reduce the days to give same chemotherapy in each cycle, and increase the interval of chemotherapy in between the cycle during this COVID pandemic. The most important here is the psychosocial support. the pandemic, which causes distress due to the social isolation, anxiety, depression, and delirium. So a study has been shown that 1/3 of the patients develop moderate to severe anxiety symptoms and 1/6 develop moderate to severe depressive symptoms. So here, face-to-face psychological support to be given as an individual or group therapy by virtually, via telephone or video call. So the counseling support like reassuring the patient and the family, giving them the positive thoughts, coping strategies teaching them, and helping them to navigate from myths and the misinformation. The pharmacological management for depression and anxiety can be provided. And here the communication should be very positive and should be bi-directional. It is not only the one person, it is both have to share their feelings and emotions. Whenever we follow up on prognosis, 50% of the cases, the high-grade osteosarcoma, they have some type of relapse in 5 months. If recurrence is detected, additional surgery, radical amputation, and chemotherapy may be warranted. And the survival rate is 5 to 23% in the 5-year. Where with the journal reference studies, which we found that outcomes have stagnated with the 5-year overall survival of 65 to 70% with no major improvement in the subset of cases of metastatic osteogenic sarcoma that continue to have very poor outcome. And there are few journal studies which I want to quote it. A study done by Guston et al. It is a case report, a radical change in osteosarcoma surgical plan due to the COVID-19 pandemic. A 17-year-old boy with the osteosarcoma of the proximal humerus was planned for the possible lip salvaging surgery after standard neoadjuvant chemotherapy. However, during the surgical phase of treatment, the COVID-19 SARS-CoV outbreak occurred, changing the healthcare landscape due to uncertainty regarding the virus and risk of COVID-19 infection and the complications, and the implementation of enhanced community quarantine, which restricts the movement of the people within cities. Instead of limb salvage surgery, the child underwent for 4-quarter amputation. Exposure to the virus in a high-risk hospital setting was minimized, with the child discharged after a short hospital stay and home convalescence monitored by a video conferencing. Multidisciplinary sarcoma team meetings with the family members, with a sarcoma navigator nurse, were crucial in managing the expectations and deciding on appropriate treatment in the setting of a novel infectious disease causing pandemic. Other one is the recommendation which has been done, the management and treatment during this COVID-19 era, the sarcomas. Chemotherapy schedules may be modified to reduce the clinical visit. Patients should receive the chemotherapy growth factor and eventually antibiotic support so as to minimize the neutropenia, while dexamethasone use should be limited as appropriate to reduce the immunosuppression. Implement the telemedicine safely, monitoring whenever possible. All patients must be managed with the best home-based supportive care, enhance symptom control via telemedicine. Bone agents for patients with bone metastasis should be delivered with a minimal time in the hospital environment. They should not stay for long period in the hospital. And oral systemic therapy should be prioritized whenever possible and prescribed for multiple courses. The predictable and manageable toxicity of oral systemic therapy should be managed via telemedicine. In the metastatic setting, following the multidisciplinary tumor board discussion, according to the preference of the individual patient, drug holidays, delayed regimens, de-escalated maintenance regimes, as well as best supportive care should be discussed, contemplating later lines of systemic therapy. So whenever we are during this pandemic, again, we need to be protected legally. What are the medical legal aspects to be considered? So during this COVID-19 pandemic, when to treat and when to wait? That is a big question mark for us. Medical legally, this is a gray area with the challenges to the healthcare people. The best strategy for hospital or the healthcare personnel to have a SOP. You develop a standard operating procedure which is going to support us legally in every aspect of patient care, from outpatient to the inpatient. Okay, when the person wants to come as outpatient, what is the protocol? Inpatient, who should be admitted, how they should be treated, how long will be there. So each and every procedure must have an SOP. So rescheduling of the treatment to surgeries, everything must have an SOP so that helps us legally. So the communication with the patient, a clear SOP, documentation, concern from the patient and the family, and recording of the teleconsult, whatever we do it, which all has the risk that should be monitored and maintained. So to conclude that, the pandemic has posed an opportunity to explore the video conferencing, the webinars, virtual tumor boards, and teleconsultation as a powerful tools of communication between the cancer patients, caregivers, and the hospital. So sarcoma management should be a multidisciplinary during COVID-19. The treatment has to be individualized based on the clinical presentation, available resources, and after due discussions in the multidisciplinary team meetings. And multidisciplinary joint clinics must shift from a closed room meeting to an interactive online meeting. So telephonic or video calling contact establishment should be done. A home nursing visit should be facilitated to ensure there is a continued medical oversight. So with this, I conclude, and I'm extremely sorry once again for the delay. If you have any queries, you can ask now. So if you have any queries, you can ask Professor Dr. Jayasudha from
Okay, thank you,
ESG,
Professor.
and this is my number and email ID.
Okay.
Thank you.
Thank you. Thank you, Professor Dr. A. Jayasudha, for the nice presentation. We are now in the discussion session, but since there is no questions, maybe there are many students want to ask directly, or there are no questions here. Oh, there is one, Prof. There is one question for you, Prof. Are you here? From Nursing Academy of Cikini, she's asking, did the Kottmann triangle complication happen often in India?
It's very rarely we see the cases. Very rare.
Very rare. Oh, there's the answer. Thank you for the question. She's not giving here the question. That's why I directly read the question. And there is another question. Came from Gokulariskan.
Yes.
I'm sorry if I wrongly mentioned the name. Came from Gokulariskan. I cannot read properly. Di mana pertanyaannya? Nggak bisa aku baca. The questions, what are the risk factors after the surgery and what can be the dietary management for the osteosarcoma patient?
Yeah, risk factors, that's all depends upon the type of surgery which they do it. And during this pandemic, the palliative and the thing they delay in it, only an emergency one they do that. And that need to be followed up. Followed by that, chemotherapy will be given based on the stages of the cancer. And dietary management is all the diets which is being given to the baby, especially the protein rich can be given for the wound healing.
Okay.
That can be done.
Okay. Another question came from Endang Puspitasari, Chris Husada Nursing Academy. She's asking, why is the osteosarcoma only common in children and adolescents? Your answer, please. Prof, are you with us?
That's because of the exposure to the radiation therapy. And this is a disease which cannot be prevented. Only thing we can reduce the further complications by altering our lifestyle modification, by reducing our weight, making obesity should not be there. Maintain a normal weight, and people who are smoking should avoid that. They need to quit the smoking.
Okay. That's all. I think there is no questions here anymore. Thank you again to Professor Dr. Jaya Sudha for wonderful explanation, even though there are many technical problems.
Yes,
So-
I'm extremely sorry once again
No
for the technical
problem.
issue which has been caused.
Yes.
And once again, I thank all of you, the organizers,
Thank you,
and
ma'am.
Professor Reza also for having given this opportunity.
Yes,
Thank you
yes.
all.
As
Thank
a
you so much.
moderator, I'm going to give a conclusion about your topic today. Sarcoma management should be multidisciplinary during COVID-19 as the number of people infected with COVID-19 increases. The treatment of carcinomas should be individualized based on the clinical presentations, available researchers, and after due discussion in the multidisciplinary team meetings. Multidisciplinary joint clinics must shift from a closed room meeting to an interactive online meeting. Also, telephonic or video calling contact establishments should be done, or home nursing visits should be done. That is the end of the conclusion. Hopefully in the future, we will have another occasion and another event. Of course, we can share our knowledge and experience. Thank you again to all speakers. The committee of the 5th International Nursing Conference feel honored to have you as a speaker today and proudly present a certificate to the speaker. This goes to Professor Dr. A. Jayasuda, Master of Science, PhD, RNRM, that will be given by Director of Pelni Nursing Academy, Nurse Buntar Handayani, Bachelor in Nursing, Master of Management. Thank you, ma'am. Ladies and gentlemen, please give a big applause to both speaker and directors. Thank you a lot to all the speakers. Thank you a lot to all participants. See you again in the next occasion. This is the end of my moderator station. Thank you so much.
Ada makna yang kan terungkap tentang perjalanan yang berat untuk kita ukir bersama jadi sebuah cerita. Pahit getirnya kisah ini, namun kuat dan menguatkan sebagai perekat setiap hati yang jomblo pada mimpi. Memang tak banyak orang yang mengerti tentang ini, tapi ikatan batin kan menggema sepanjang waktu. Percayalah, kita melegenda di sana. Pilih masa depanmu di warna mimpimu. Jika kita pernah berbagi air mata, sahabat jangan lupa bahagia bersama. Baiknya sejenak renungkan, kita diciptakan berbeda demi satu pesan yang sejuk untuk saling melengkapi. Memang tak banyak orang yang mengerti tentang ini, tapi ikatan batin kan menggema sepanjang waktu. Percayalah, kita melegenda di sana. Pilih masa depanmu di warna mimpimu. Jika kita pernah berbagi air mata, sahabat jangan lupa bahagia bersama.
bersama. Percayalah, kita menyatukan semua mereka yang selalu ragukan dirimu. Jika kita pernah berbagi air mata, sahabat jangan lupa bahagia bersama. Pilih masa depanmu di warna mimpimu. Sahabat jangan lupa bahagia bersama. Vokasi berjaya.
Okay, thank you for the video. I'm going to take over again for the oral presentation. I already introduced our speakers, but I would like to remind you from the three institutions that are already introduced before. From Nursing Academy of Kerisusada, we have 3 speakers. From Nursing Academy of Pasar Rebo, we have 2 speakers, and from Nursing Academy of CCI Cikini, we also have 2 speakers. Now, maybe some of you might not remember, previously I would like to say that if you have any question, please wait until the end of the session to give your question, because at the end of our sessions, we will have a discussion session. In the session, we will allow you to give your question to the speaker. And if you feel like you may forget this questions later, then please type down your question using Zoom chat box. Or if you are watching this conference from YouTube, you may use the comment section to type down your questions. Now, for the speakers, we will give each of you 15 minutes to deliver your presentation. Okay, without further ado, let's start with our oral presentation. For the first speaker from Nursing Academy of Kerisusada, please welcome Mr. Sumrahadi, Master of Public Health. He's going to give us a presentation about the level of academic burnout among nursing students during COVID-19 pandemic. For Mr. Sumrahadi, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. I hope we are all in good health. Good afternoon, ladies and gentlemen. I am Sumrahadi from Kerisusada Nursing Academy. I would like to present my research. The title is Nursing Student Academy Burnout Rate During Pandemic COVID-19. This is the outline of my presentation. The first, we will talk about the background of the study, concept burnout, and how I did my study, or which is the method of the study, and then the result of the study, and the last are a discussion and conclusion. Okay, well, let's continue. This background of study, since WHO declared pandemic COVID-19 and we all feel it until now, all countries have experienced a crisis in all aspects of life. This crisis is felt by everybody from all corners of the nation, continent, race, and social group. To prevent the spread and transmission of the coronavirus, the government, through its policy, has imposed restrictions. One of the restrictions affected is the education sector. And now students, parents, and lecturers have new challenge. What the challenge? It is online learning activities. The impact of the online learning, it's make many of them, especially for students. Of course, they experience boredom, stress, and burnout. The previous research, the result of research conducted by Livana, state that learning assignment were the main factor causing student stress during pandemic COVID-19. This is supported by Andiarna research, which states that online learning affects academic stress during pandemic COVID-19. And according to Simbolon, academic stress is mental and emotional stress or tension that occur due to the demand of campus life. The aim of the study, the purpose of this study was to determine the burnout level of nursing students with online learning during pandemic COVID-19. Okay, now we see the concept. Burnout study is a feeling of fatigue to the demand of study, having a cynical feeling and an attitude of being spirited or away from school, indifference to academic tasks, feeling incompetent as a student. There are three dimensions of burnout study. There is emotional exhaustion, cynicism, and reduced academic efficacy. Okay, well, method in my research. In this research, I use quantitative methods with a descriptive approach. And then the data was taken using the Maslach Burnout Inventory student survey. The questionnaire was distributed through the WhatsApp group by providing a Google Form link. And then the result of the research were analyzed univariate and presented in a frequency distribution. Total sampling respondent is 188 nursing students, and inclusion criteria for the research is nursing student at level 2 and 3. Okay, how the result? This table is score about exhaustion score on nursing student, where more than half experience high exhaustion. It is 51.06. And the second table, we can see that the score of cynicism aspect, it was obtained that almost all students had a high cynicism condition. It is 89.89. The third, the table show that the score of the reduced academic efficacy aspect is at a low score, where almost all students are in a low reduced academic efficacy condition. Where the lower the value obtained, the worse the reduced academic efficacy. This indicates that the lower the efficacy score, the burnout level is higher. The last table, the result of data processing are now that most of the students' academic burnout score are a high score. This means that the burnout level of student dominates. Okay, this slide is discussion. Burnout in student is caused not ready to study online. That is an internal factor, while the external factor is the monotone of lecturer in teaching. Like Wisnores revealed that burnout is influenced by internal factor, where introvert personality and neuroticism are more susceptible to burnout. The impact of burnout will be a severe psychological problem, as well as decreases learning achievement. There is a significant influence between burnout on learning achievement. The greater learning burden, the higher the burnout level experience. So that the achievement obtained is decreases. The problem of excessive learning burden is one of the factors that can have an impact on the burnout. Excessive learning burden can be in the form of crowded classes, many assignments, routine exercise, or other exercise than beyond individual ability and capacities. This is conclusion. Online learning causes burnout for students, so it is important for educational institutions to explore online learning method so that students don't become burnout and achievement during the pandemic remain optimal. So that's all my sharing about my research. Hopeful it's useful, and I apologize if there are still many mistakes in this presentation. So thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Sumra Hadi, for your presentation. Moving on, we are going to move to our next speakers from Nursing Academy of Pasar Rebo. Please welcome Nurse Sri Nyumira, Magister of Nursing, specialized in psychiatric nursing. The presentation she's going to give us is about the psychological impact on health workers during the COVID-19 pandemic. For Nurse Sri Nyumira, time is yours.
Good morning and hearty greetings. Introduce myself, Sri Nyumira Akbar Pasarbo. I will present the result of my literature review on the psychological impact of hard work during the COVID-19 pandemics. I share screen. My literature review psychological impact on health worker during the COVID-19 pandemic. Next, preliminary. Coronavirus is a virus that has a physical impact on death and disruption of the respiratory system almost every day. Yeah, in addition to the psychical impact in the will have a mental health impact that will cause psychological problems. Health worker play a very important role in help to overcome the COVID-19 virus outbreak so that it has a psychological impact on being stressed and anxiety because the workload is too heavy because of the risk involved in treating patients with COVID-19. The impact of the COVID-19 pandemic will appear psychological problem. Stress for health worker can occur due to separation from close family due to tasks that must be done. The fear that arises can be infection with the virus, feeling fail to deal with that condition in patient. One fear, two anxiety, 3 depression, and 4 failing nursery. The method used in the literature review is don't be selection the topic to be discussion that creating keyword psychological impact for healthy work on COVID-19, then the set for article is carried out. We collection them that met the inclusion criteria from 2020 until 2021 in English and Indonesia and full text. Results are based on 8 articles with keyword and criteria that have been determined that the psychological impact on health worker in the COVID-19 pandemic is obtained health worker experience mild stress to severe stress due to variant pressure that occur and the fear of being exposed to infection that will transmit the family, friend, and the local community. Discussion, health worker as professional have negative impacts that cause a person to feel lonely, feel uniform. This is accordance with research conducive from workers, and stress that occur in health workers because they feel unable to carry out treatment, personal protect equipment is running low for healthcare needs. Health workers are a very vulnerable population because a very risky situation during a pandemic, namely with a sense of worry in treating patients, morally very vulnerable to suicide education and failure on helping treatment. When finding a client who asks her did conditioner and cannot be safe, this is accord with research from brand. And then discussion, one of the other cause of psychological problem during the pandemic is the increased workload of hard work. The use APD that is quite strict hard worker in direct contact with patients who are confirmed positive, limited equipment to prevent exposure to the COVID-19 virus universally. Yeah, as the COVID-19 outbreak situation evolves, team leader must have staff understand the moral decisions that are being made with which achieved by using forum based on the discussion of healthcare staff from you all background to discussion the emotional and social health challenge of caring for patients. Conclusion from the journal review, it was found that psychological impacts obtained on health worker during the COVID-19 pandemic were experience stress, anxiety, difficulty sleeping, and trauma to pandemic condition, the risk of suicide, and feeling help, psychological change such feeling of fear, anxiety, depression, or feeling uneasy. Okay, thank you to all of you. God head greeting, keep the spirit, take care, good morning. Assalamualaikum warahmatullahi wabarakatuh. Goodbye.
Okay, thank you for Sri Numira for the presentation. Before we move on to our next speaker, I would like to remind you, if you have any question, please write down your question on the Zoom chat box, or if you're watching this conference from YouTube, please write down your question on the comment section. Now, we are moving to our next speakers. Please welcome from Nursing Academy of CCI Cikini, Nurse Santa Maria Pangaribuan, Bachelor of Nursing, Master of Science, and she's going to give us a presentation about the relationship between parenting style and stress for parents during the COVID-19 pandemic in Bojongsari, Depok. For Nurse Santa Maria, time is yours.
Thank you so much for this chance. My name is Santa Maria Pangaribuan. I am from Nursing Academy of PGI Cikini. Today, I will try to share my study with the title Relationship Between Parenting Style and Stress for Parents During the COVID-19 Pandemic in Bojongsari, Depok. As a background, the COVID-19 pandemic due to the infection with SARS-CoV-2 has spread all around the world, including Indonesia, and is showing very fast transmission. The World Health Organization on March 11, 2020, ratified COVID-19 as a pandemic. The coronavirus has many impacts in our life, not only social and economical problem, but also psychological problem. Various efforts to reduce the number of infected cases have been carried out, including restriction on mobility, social quarantine, or stay at home. Mental health problems often occur during the natural disaster, but lack of serious attention to handling it. It is known from the pandemic that occurred in 2001, SARS-CoV-1, that the population experienced psychological stress during the pandemic at the time. The COVID-19 pandemic has caused stressor in many households. Parents have to adapt between their children being homeschooled, working remotely, or not being able to work at all, while worrying about financial and health problems for the family. In addition, parents provided many new rules for the children should adapt it to their condition as well during the COVID-19 pandemic, seeing their children change from obedient beings to rebels. This condition not only provides new stressor for parents, but puts more pressure on children. Prolonged parental stressor can create a bad influence which may cause individuals perceive this event as stress that can affect poor parenting style for children. While appropriate parenting style by parents is done by providing emotional, social, and intellectual support for children through communication, especially in meeting the needs of children during the mass quarantine. Children who experience poor parenting style and high stress level can affect developmental delays, mental health disorder, disease such as asthma, diabetes, obesity, and in the future, it might affect 4 times the decline in physical and mental health condition. During the COVID-19 pandemic, most of the research was conducted to look at physiological problem in the general population, and only a few studies explored the impact of COVID-19 on parents and children. Next slide. So the purpose of this study is to explore the relationship between parenting style and stress among parents during the pandemic COVID-19 in Depok. Next slide. As a method, this is cross-sectional study design. An online survey was created via Google Form for investigate the parenting style, including democratic, authoritarian, permissive, and stress during the COVID-19 pandemic in Depok. Survey data collection was from May 2, 2021 to June 8, 2021. Residents of Bojongsari, Serua, Depok were initially targeted in this study. The questionnaire included 44 questions and took 10 until 15 minutes to participants to complete it. The sample of this study was parents of children aged 0 months until 17 years and agreed to participate in this study. The total 40 respondents joined in this study. Parents who were not biological of children was excluded from this study. Next slide. The instrument that we use in our study consists of 3 parts. The first part of survey is to explore demographic characteristics, including children age, educational level, and employment status of parents. And the second part of questionnaire is parenting pattern questionnaire, was adapted from Budi 2020 that consists 30 items which provide to respond each question yes and no. The third part of questionnaire is Depression Anxiety Stress Scale Questionnaire Bahasa Indonesia version that was translated by Damanik in 2011 for measure the subscale of stress. Next slide. For the validity and reliability, for the questionnaire parenting pattern, the Cronbach alpha show the 0.64 for democratic parenting, 0.74 for authoritarian parenting, and 0.71 for permissive parenting. For the DAS questionnaire Bahasa Indonesia, the reliability of the DAS version show was excellent, with the score 0.95, and the Cronbach alpha coefficient for stress level was 0.88. This evidence shows that all questionnaire in this study has a good validity and reliability. Next slide. For the data analysis, descriptive statistic and bivariate correlation among study variable was performed by using SPSS version 20.0. For the result in our study, next slide, we can see in the table 1. Table 1 shows demographic characteristic of participant. All respondents who complete the survey were mother 100%, and most were highly educated 65%, having at least a university degree. Most parents were also employed as homemaker or full-time parents, around 75%. Next, table 2 shows the parenting style of parents. The mean score of parenting style was 17.5 with standard deviation 2.09. About 82% of parents apply democratic parenting. Next, table 3 shows the score of stress among parents in Depok. We can see with the mean score of stress was 13.8 with standard deviation 6.5. 65% parents reported no or minimal stress, 70% experienced mild stress, 15% had moderate stress, and 2% suffer from very severe stress. Next, table 4 shows the stress level by demographic characteristic of parents. 30% of parents with senior high school education experienced mild stress, and 20% had moderate stress. 30% of parents who work as private employees experience mild stress, and 33% who work in government experience moderate stress level. Next, table 5 shows the parenting style by demographic characteristic of parents. We can see from this table, the results show that 84% of parents with diploma or university education apply democratic parenting. 80% of parents as homemaker or full-time parents also applied democratic parenting. Next slide. Table 6 shows the majority of parents we can see applied democratic parenting. The results show that the majority of parents who reported no stress or minimal stress level applied democratic parenting, around 76%. Parents who reported mild stress level also applied democratic parenting, and 14% applied authoritarian parenting. One-way analysis of variance ANOVA we use to examine the relationship between parenting style and stress among the parents in Depok. The results show that there is no significant relationship between parenting style and stress among parents in Bojong Sari Depok with alpha 0.78. Next slide. As discussion, first, Our finding indicates that a few parents experience moderate and very severe level of stress. Most of the parents reported minimal or no stress, but given evidence in the literature show that although not all parents experience severe stress due to the COVID-19, but they are also at higher risk of poor parenting style. Second, the current study show most of parents in our study applied democratic parenting. Previous study conducted by RUS 2021 showed that a supportive and consistent parenting style had impact on children's resilience to stress, especially during mass quarantine. Parents should be the main ones to support their children through effective interaction and communication. Third, our study confirmed that no significant relationship between parenting and stress among parents in Bojong Sari, Depok. This result confirmed from the previous study there was no association between parenting and stress among parents of mentally retarded children at the Palembang Disabled Child Developmental Foundation. Next. As a limitation in our study, this study has several limitations that should be considered when interpreting the result. First, this study is a cross-sectional study, so we are unable to examine any future effect that may exist between the relationship of these two variables. Second, the sample size was quite small, so it is important to conduct further research in this area. Third, most of respondents in our study is mother, even though parenting pattern of fathers and mothers has a different impact on children. Source of funding, the author declared that the study received no funding. Acknowledgement, special thanks to Nursing Academy of PGI Cikini for valuable support. Next slide. This is several references that we use in our study. Next slide. Next. Thank you so much for your attention.
Okay, thank you for Nurse Santa Maria for your presentation. We are going to move on to our next speakers. Our next speakers come from Nursing Academy of Keris Husada. Please welcome Ms. Eni Sumartini, Magister of Nursing, and she's going to give us a presentation about a phenomenological study of experience of parents who have children with stunting. For Ms. Eni Sumartini, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Thank you for time to research presentation. My title is Phenomenological Study of the Experience of Parents who have children with stunting. Background. One of the chronic diseases experienced by children are stunting. Stunting describes the malnutrition that is chronic, can occur during growth and development since early life. In Indonesia, based on the result of the 2019 Indonesian Nutritional Status Survey, there were 27.67% of children under 5 who experience stunting. If this stunting occurs during the golden period of brain development, 0 to 3 years, then the brain cannot develop properly. The reaction that arises in parents when their children are said to have problems with physical or health condition or disbelief, inner turmoil, surprise, and disbelief in the reality that befalls their children. Objective of the research. Based on the background that has been widened, this study aims to explore the experience of parents who have children with stunting. Literature review. Definition of stunting. Stunting is a form of stunted child growth process. Risk factor and causes of stunting in children, nutritional status of pregnant women, nutritional intake of infant under 2 years old, infection, environmental sanitation, and parenting. The impact of stunting on children: increased morbidity and mortality, stunted motor and mental development, intellectual decline, and productivity increases the risk of degenerative disease, obesity, and is more susceptible to infectious disease. Government effort in preventing stunting in children, priority intervention in the National Strategy for the Acceleration of Stunting Prevention 2018 to 2024 include specific nutrition intervention and sensitive nutrition intervention. Research methods. The study uses a qualitative design. The approach used in this study is phenomenological. The type of phenomenological selected is descriptive phenomenology. Sampling technique. Technique is for taking sample from the population using techniques non-probability sampling. The criteria used are a parent who has a child with stunting. The number of samples in the study were 7 participants. Time and place of research. This research was conducted in the range of January to December 2020. The research was conducted in the working area of the South Jakarta Public Health Center. Data collection method. In this research is by way of intervention and field note, and 2 intervention techniques used in technique depth interview with question semi-structure. The data collection tool was the researcher himself who was assisted by a media player MP4, interview recorder, field notes, stationery, and interview guidelines. The process of data analysis in this phenomenological qualitative research used the 9-step data interpretation method according to Polizzi. Research description of participants in this study are parents who have children with stunting. The number of participants is 7 people with an age range of 30 to 45 years. Education of participants is 14.7%. Elementary school SD 28.6%, junior high school SMP 14.7%, high school SME, and 42.9% higher education PT. Children's age range from 15 months to 5 years. Children in this study were identified as stunted based on the Z-score of height for age TBU less than means 2 standard deviation based on the child anthropometry standard according to the regulation of the Indonesian Ministry of Health number 2 of 2020. This study aims to explore the experience of parents who have children with stunting. Researchers succeeded in uncovering 4 themes, namely parental knowledge, parent experience in caring for children, parent psychological response, and support system. Of the 7 participants, there were 3 participants, P1, P2, P3, who had never heard of stunting and didn't know what stunting was. All participants experienced a condition where the child had difficulty eating, lacked appetite, and had little food intake. Psychological responses experienced by 6 participants, P1 to P6, felt sad and worried about the condition of children who were less tall, and there was even one participant, P4, who was very worried after the child entered school that his friends would be bullied. There is one participant, P7, was feeling abnormal, not sad and worried because the neighbor children are the same age, not much different in height. A total of 4 participants, P2, 4, 6, and 7, never received information from Posyandu, Puskesmas, or other health facilities that their children were stunted. A total of 5 participants, P3 to P7, started that the Posyandu and health center didn't take special measures to deal with stunting children. Discussion. Mothers with low level of education, SDSMP, have never heard of and don't know what stunting is compared to mother with higher education, high school PT, who know about stunting from Instagram parenting seminar and forum. All participants experience a condition where the child had difficult eating, like appetite, and had little food intake during the previous years. Anthropometry status screening is needed, especially high and egg and counseling for parents, and continuous effort if there are findings of stunting by involving Posyandu cadres. Other strategies are also necessary by involving these UKS programs to educate students and teachers regarding stunting prevention and management. Research implementation obstacle faced during the research were when data collection, not all parents whose children were identified as stunted were failing to open up and want to interview because parents felt their children were fine. Researchers experienced several rejections so that they had to identify other parents who would be targets. Besides the COVID-19 pandemic, parents are worried about accepting foreigners into their homes. Research follow-up plan. 1. Conduction research related to factors that influence the difficult caring behavior in stunted children and experimental research on the effect of interactive imaginative videos on change in difficulty eating behavior in stunted and malnourished children. 2. Carry out continuity services involving posyandu, current stunting screening in programs and stunting health education for children. Thank you very much.
Thank you for our presenter, Ms. Annie Sumarsini. We are going to move on to our next speaker. Please welcome from Nursing Academy of Keris Husada, I apologize. Please welcome from Nursing Academy of Pasar Rebo, please Nurse Yuanita Panma, Magister of Nursing, specialized in medical surgical nursing. She's going to give us a presentation about factors which affecting COVID-19 vaccination acceptance in general population. For Nurse Yuanita Panma, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. I hope all of you in a good and healthy condition today. I am Yuanita Panma. I am from Nursing Academy of Pasar Rebo. First of all, thank you for the committee for the opportunity given to me to present my study. The title of my study is Factor Affecting COVID-19 Vaccines Acceptance in General Population, a literature review. Now, I want to share screen my study. Okay. I divided my presentation today into 4 sections. The first is introduction and objective. The second is methodology. The third is result analysis. And the fourth is conclusion. First, for introduction, the first COVID-19 infection case was recorded in Wuhan back in December 2019. The rate of spread of this SARS-classified virus was not predetermined until it was established that it was highly contagious a month later. According to World Health Organization, COVID-19 can be transmitted mainly through respiratory droplets when individuals are within a range of 1 meter. Thus, one can easily get infected if they use objects or surfaces that have been in contact with an infected person or directly being in contact with such a person. In 2020, the infectious coronavirus disease 2019 or COVID-19 had spread globally and affected individuals from all walks of life. According to the World Health Organization, in June 2021, the world's cumulative COVID-19 confirmed cases increasing from 106.2 million in February to 178.5 million in June. And the total number of deaths thus far was 3.8 million. A COVID vaccine is a vaccine intended to provide acquired immunity against severe acute respiratory syndrome coronavirus. The COVID-19 vaccines are widely celebrated for their role in reducing the spread, severity, and death caused by COVID-19. While vaccination is widely recognized as an effective way to reduce or eliminate the burden of infectious disease by health authorities and the medical community, its benefit also depends on the willingness of individuals to be vaccinated. This is the case with the COVID-19 vaccines that might be the key to stopping the COVID-19 epidemic. Vaccine hesitancy, the unwillingness of a proportion of the population to get vaccinated, is closely related to public trust in the health system. To develop an effective communication strategy to advance vaccine readiness, it is crucial to understand the various socio-demographic factors that affect the decision. It is particularly important to find out the positions of those on the vaccination priority list, such as different groups of healthcare professionals. This is a total number who have been administered of vaccines in the world. Okay. The objective of this study is to review several studies about factors affecting COVID-19 vaccines acceptance. Okay, the second, methods. I use literature review methods with 4 search engines, Wiley Online Library, Clinical Key, ProQuest, and EBSCO. With the inclusion criteria are article in English published in 2020 and 2021 and full text with the keyword COVID-19, vaccines, and acceptance. The third, result analysis. We found 1,043 literatures who match with the keyword. After we filtered with the inclusion criteria, we found 13 suitable literatures. Based on the literatures, countries which have acceptance rate more than 80% are United States, Australia, Israel, Brazil, Malaysia, Thailand, Bangladesh, Democratic Republic of Congo, Benin, Uganda, and Malawi. Most of literatures describe age, level of education, experience of vaccine before, gender, chronic disease, and race as a factor affecting COVID-19 vaccines acceptance. Okay, we can see in this table about COVID-19 acceptance rate. There is 1, 2, 3, 4 country who the acceptance rates more than 80%. And for factor affecting COVID-19, we found 19 factor. There are age, level education, vaccines experience before, COVID-19 knowledge, worry or fear regarding COVID-19, higher income, testing negative for COVID-19, chronic disease, gender, health provision, belief vaccine is safe, willing to pay for vaccines, race, medical personal advice, social media use, attitude towards the vaccine, the perception that prevalence and death rate reports of the government are real, having a close relative or friend ever infected by COVID-19. Perception that prevalence and death rate reports of the government are real. For age, younger participants aged more than 40 years had significantly unwillingness to get vaccinated. In contrast, study in Slovenia showed that older respondents had a higher intention to get vaccinated than younger respondents. And then for level education, the percentage of participants with undergraduate degrees were higher among participants who were not willing to receive a COVID-19 vaccine. In contrast, study conducted by Smueli in 2021 show educated respondents higher intention to receive COVID-19 vaccines and lower educational attainment associated with vaccine hesitancy. Acceptance increased with the increase of COVID-19 knowledge. Participants who had previously refused vaccination were refused the COVID-19 vaccines. This is in line with study conducted by Smueli, who had received that respondents who had received the seasonal influenza vaccine in the previous year stated higher intention to receive COVID-19 vaccine. And then acceptance of COVID-19 vaccine also increased with the increase of worry or fear regarding of COVID-19. Participants were currently employed were higher among participants who were not willing to receive a COVID-19 vaccine. Participants unwilling to receive COVID-19 vaccines higher among those who were employed than those unemployed or retired. For the conclusion, there were 13 suitable literature came from various countries. Factors affecting COVID vaccines acceptance were age, level of education, vaccines experience before, COVID-19 knowledge, worry or fear regarding COVID-19, higher income, testing negative for COVID-19, chronic disease, gender, health provision, belief safety in vaccines, willing to pay for vaccine, race, medical personnel advice, social media use, the perception that prevalence and death rate reports of the government are real, having a close relative friend ever infected by COVID-19. Okay, that's all for me. I hope this study useful for all of us. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you for our speakers. We are going to move to our next speakers. Our next speakers come from Nursing Academy of Kris Husada. Please welcome Ms. Yulianti, Magister of Nursing. She's going to give us a presentation about the effect of psychoeducational intervention for caregivers burnout of clients schizophrenic. For Ms. Yulianti, time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Yulianti. I am a lecturer from Academic Nursing Kris Husada, Jakarta. I will present of my research about the effect of a psycho-educational intervention for caregiver burnout of clients schizophrenic. Background: the prevalence of burnout in caregiver client schizophrenic saw a high case compared to other chronic disease. Burnout is a psychological tension that is specifically related to chronic stress experienced by an individual from day to day and is characterized by a state of physical exhaustion, mental, and emotional condition can cause caregiver depression or a mental disorder. Psychoeducation is an intervention that can be used to solve the problem facing caregiver in caring for clients with schizophrenia. The study aims to show the effectiveness of therapy caregiver burnout psychoeducation for client schizophrenic. Burnout can lead to decreased effectiveness of individual performance. Burnout, which is a physiological syndrome consisting of three dimensions, namely emotional, exhaustion, depersonalization, and decreased achievement. Method. The study designed by quasi-experimental using pretest post-test control group design with one kind of treatment. The sample was 32% within a control group of 16% and 16% in another. The intervention group got psychoeducational therapy, while the control group didn't get any intervention. The level of caregiver burnout was measured by using the Maslach Burnout Inventory Human Service Survey. The data was analyzed by using Mann-Whitney test scores to determine the difference in level of burnout caregiver before and after intervention psychoeducation between the control group and intervention group. Result. Burnout score of schizophrenic caregiver in the intervention group. Before, score mean is 1.375 and after 2.5. And score p-value is 0.002. The table above shows that the burnout level of caregiver in the intervention group at the time after the intervention show a high score, 2.5 compared to 1.375, or experience a lower level or decrease than before the intervention. The decrease was significant. Based on the Wilcoxon test, p-value equal 0.002. Because the significant number is less than 0.05, H0 is rejected. In other words, there are different in caregiver burnout level before and after psychoeducational intervention in the intervention group. Burnout score of schizophrenic caregiver in the control group. Before intervention, score mean is 1.375 and after intervention 1.375 and score p-value equal is 1. From the table above, it can be concluded that the burnout level of caregivers in the control group at the time after the intervention saw the same large score, but 1.365, or did not increase or decrease. Based on the result of the Wilcoxon test, p-value equal is 1 because the score before and after are the same, so there is no difference. Then H0 is accepted. In other words, there is no difference in caregiver burnout level before and after psychoeducational intervention in the control group. The difference in burnout level of schizophrenic caregiver in the control group and the intervention group before the intervention. Control group score mean is 1.375 and intervention group score mean is 1.375 and score mean Whitney is 128. From the table above, it can be concluded that the burnout level of caregiver in the control and intervention group at the time before the intervention show the same large score, but 1.375 or so no different. Based on the result of the Mann-Whitney test, it was obtained U equal 128 with p-value equal 1. Because the score before intervention in the intervention and control group were the same, so there are no difference. The difference in burnout level of schizophrenic caregiver in the control group and the intervention group after the intervention. Control group score mean is 1.375 and intervention group score mean is 2.5 and score Mann-Whitney is 24. From the table above, it can be concluded that the burnout level of caregiver in the intervention group score was 2.5 compared the control group score 1.375 indicate that the intervention group experienced an increase in score or a decrease in burnout level. The score has a significant decreasing. According to the Mann-Whitney test with p-value equal 0.001, so H0 is rejected. In other words, there are different in caregiver burnout level in the intervention group and the control group after the intervention. Conclusion. Psychoeducation intervention is effective in reducing the level of caregiver burnout client schizophrenic. Psychoeducation therapy can be applied in dealing with psychosocial problem experienced by the caregiver client schizophrenic. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for our speaker, Ms. Yulianti. We are going to moving on to our next and also our last speaker for oral presentation today. Please welcome from Nursing Academy of CCI Cikini, Nurse Lince Siringo-Ringo, Magister of Nursing, specialized in pediatric nursing. She's going to give us a presentation about the sleep quality among nursing students during COVID-19 pandemic. For Nurse Lince Siringo-Ringo, time is yours.
Thank you, our beautiful moderator, Altania. Can you hear me?
Yes, we can, ma'am.
Okay. Good day, everyone. My name is Lince. I'm a lecturer from Nursing Academy, PGI Cikini. My talk today about sleep quality among nursing students during the COVID-19 pandemic. Next. Next. At this time, the first I will explain about background. Background in this study is about pandemic COVID-19, effect on all aspects, impact of pandemic COVID-19 on education, sleep quality of nursing students. Next. The COVID-19 pandemic in Indonesia is part of the ongoing COVID-19 pandemic worldwide. Starting in March 2020, the day on which the first case of SARS-CoV infection, severe acute respiratory syndrome, was diagnosed in Indonesian citizens, and in the April 2020 has spread to 34 provinces in Indonesia. The pandemic has had severe and profound effects on all aspects of our life, including mental and physical health. Impact of COVID-19 divided into three sectors, that is social, economic, and health. On health sector, COVID-19 affect mental health like stress, and that can cause changing quality of sleep. Health behaviors of higher education students can be negatively influenced by stressful events. Next. Impact of pandemic COVID-19 on education. Work from home has become the norm, especially for service organizations. Following government's instruction, even the academic institution had to shut down temporarily, affecting academic delivery. Thus, they had to find a new alternative to academic delivery, and virtual classes were the way forward. In the present paper, we try to study the impact of virtual learning of the sleep quality of nursing students during the COVID-19 pandemic. The correct COVID-19 pandemic is causing psychological problems such as stress, worry, fear, anxiety, depressive syndrome, and sleep disorder in the general public. It's also resulting in low level of sleep quality caused by stress and anxiety. Studies in students in various countries such as China, India, America experience poor sleep quality, also accompanied by a high diet and alcohol consumption. Research in Indonesia also shows that mental disorders occur, one of which result in poor sleep quality, including nursing students. Next. The purpose of study is to knowing description quality of sleep nursing students Cikini Academy in the COVID-19 pandemic. Next. The new epidemic phenomenon called COVID-19, which originated in Wuhan, China, continues in increase its victims. Psychological problems that occur as a result of this pandemic are sleep disorder. Sleep is a way to eliminate fatigue and restore energy. Sleep phases are divided into two, namely non-rapid eye movement and rapid eye movement. Non-rapid eye movement, there are three phases on the REM sleep. Each stage can last for 5 to 17 minutes. Stage 1, your eyes are closed, but it's easy to wake up. This phase may last 5 to 10 minutes. Stage 2, you are in light sleep. Your heart rate slow and your body temperature drop. And stage 3, this is the deep sleep state. And REM, the first period of REM typically lasts 10 minutes. Each of your later REM state gets longer, and the final one may last up to an hour. Your heart rate and breathing quicker. You can have intense dream during the REM sleep since your brain is more active. REM is very important because it stimulates the area of brain, then help with learning and associate with increased production of protein. Next. Methodology. Methodology of this study is the type is quantitative, using the description receipt decide population of the population and sample, population or student of Academy of Nursing RSPG Cikini. The sample this study was 1901 student. The research was carried out from January to June 2021. 2021. Tools. The tools used in the research in the Pittsburgh Sleep Quality Index (PSQI) questionnaire. Next. The PSQI, recognized as international standard instrument, the PSQI questionnaire measuring sleep quality consists of 19 questions, which measure 7 components of the assessment, namely subjective sleep quality, sleep latency, sleep duration, habitual sleep efficiency, sleep disturbance, and use of sleeping medication, and the last, daytime dysfunction. Next, research ethic, autonomy. In simple sense, autonomy is about person's ability to act on his or her own value and interests. After being given an explanation of the purpose of the study, the respondent has the right to choose to agree or disagree. Confidentiality, the information provided by the respondent is granted to be confidential. And the last, then efficiency. Then efficiency means that the action taken has benefit for the respondent. Next, result and discussion. The table 1 shows descriptive characteristic of the population. We can see the mean of the age is 20, and the gender of respondent, 84% are female. Next. Yes. The table 2. Yes, sorry. The table 2, distribution of score PSQI. Component of PSQI, the number 1 is subjective sleep quality. We can, that show 40.7% respondent fairly bad of subjective sleep quality. Sleep latency. Sleep latency is amount of time it takes you to go from being full awake for sleeping. That result 36% sleep latency, only 2 hours in 24 hours. Sleep duration, the sample the respondent less than 5 hours sleep in 24 hours. Habitual sleep efficiency, and then sleep disturbance, daytime function, and use of sleeping medication. Next. Table 3 is distribution of sleep quality. The respondent have poor sleep quality is result 76%. Next. Characteristic of respondent age is the range of 18 years to 24 years. The average age of respondent is 20 years, and the gender is dominated by female, 45.6%. Next. The result of this study is about 19 students that being respondent, 76% have bad or poor quality of sleep, and 24 have good quality of sleep. Result from this study, the most component of sleep quality were in the category of daytime dysfunction, because the student feel sleepy when they have activity on the noon and have a big problem for their sleep. Next, in this study, it was also found that students had taken sleeping pills 1 or 2 a week, even though the percentage was very small. Student was experienced sleep disturbance 1 or 2 a week are 21%, while those who experience sleep disturbance once a week are 29%. Conclusion. Most of the students' sleep quality in the study had poor sleep quality, so it can be concluded that the COVID-19 pandemic had a negative impact on students' sleep quality. Students at young age were also found to have used sleeping pills 1 to 2 times a week. This is a condition that requires both family and professional help. Thank you.
And thank you for Nurse Licha Sirinoringo, and that's everyone. Our second speakers for today's oral presentation. Now, I'm going to move on to our next sessions, which is the discussion session. Today, we already have a few questions. I'm going to start with the first question. The first question came from Nursia from Nursing Academy of Trisusada. She wants to give her question to Mr. Sumra Hadi. And her question is, what needs to be prioritized in aspect of mental health intervention for someone with burnout? For Mr. Sumra Hadi, you may answer her question.
Okay, thank you for the question, Miss Nursia from Upper Krisusada. Good question. The question is, what priority intervention should be performed on someone who is experienced burnout? Of course, we can approach students who have a symptom of burnout, and then we can ask the student what the online learning problem is. If the cause is no, we can take a psychological approach to provide motivation that we must face the condition of online learning happily. Yeah, you can happy with online learning, or you can manage negative emotional by experience emotional things such as doing your hobby that you enjoy. Maybe that's my explain. I hope that can be understand. Thank you.
Thank you for Mr. Sumra Hadi, and I'm sure for Nursia will be satisfied here with your answer. We are going to move on to our next question. Our next question is from Tarisa from Nursing Academy of Pasar Rebo. Her question is actually quite interesting. She wants to give the question for Ms. Yuanita. it's quite interesting because he not only giving a question, but there's also a little story behind these questions. So I'm going to give the question first. We want to ask how to change the stigma of the wider community so that they want to be vaccinated. Because this is the story. She and her friends actually just got vaccinated yesterday, and they feel some side effect from those vaccination, and they feel experience some kind of COVID-19 simulation, and she thought maybe this is the reason why the people feeling like the vaccination have a very negative stigma. And like I said previously, her question is actually how we change those stigma, how we make people want to be vaccinated. Okay, that's for the question. For Ms. Yuanita, you can answer her question.
Okay. Thank you for Tarisa, for your questions. Okay, we know that the COVID-19 vaccines are highly effective, but they are also reactogenic. That meaning that the vaccines likely to cause a noticeable immune response. The most common side effects is soreness on the site of injection. Other side effects include fatigue, headache, muscle ache, chills, joint pain, and possibly some fever. Based on your story, your experience, I can describe that the effect of the vaccine varies from person to person, depending on a person's health condition and a medical history. And then, how can we change the stigma of the vaccines? Because we know that various public stigmas related to vaccines are not only related to after being vaccinated, but there is the wrong perception about vaccines, make triggers and stigmas are not easy to change. The things that can be done by educating about the importance of vaccines and their consequences, as well as checks that must be carried out before the vaccines and what are the conditions, so that after the vaccine is given, contact if there are symptoms. I mean, if there is any symptoms, you must contact the healthcare. Maybe that is my answer.
Okay, thank you for Ms. Yuanita for your answer, and I'm sure Tarisa is quite satisfied with your answer. Okay, everyone, that's actually our last question for oral presentation today. And I'm going to close our oral presentation by giving you the conclusion from its presentation. The conclusion for today is the first for the topic, the level of academic burnout among nursing students during COVID-19 pandemic. The conclusion is online learning causes burnout for students. So it is important for educational institutions to explore online learning methods so that students don't become burnout and achievement during the pandemic remain optimal. For our second topic is the psychological impact on health workers during the COVID-19 pandemic. The conclusion is from the 8 journal that being reviewed, it was found that the psychological impact of pain health workers during the COVID-19 pandemic were experiencing stress, anxiety, difficulty sleeping, and trauma to pandemic condition, the risk of suicide, and feeling helpless. Psychological change such as feeling of fear, anxiety, depression, and feeling uneasy. For our third topic, the relationship between parenting style and stress for parents during the COVID-19 pandemic in Bojong Sari, Depok. The conclusion is actually the first one is the findings indicate that a few parents experience moderate and very severe level of stress. And then also the current studies show that most of parents in the study applied democratic parenting. And interestingly, there are rare parents who applied authoritarian parenting style. And the study also confirmed that no significant relationship between parenting and stress among parents in Bojong Sari, Depok. Okay, we're moving on to our fourth topic is phenomenological study of the experience of parents who have children with stunting. And the conclusion is actually the conclusion, we have to conduct more follow-up research. One of the follow-up plan is actually conducting research related to the factors that influence the difficult eating behavior in stunted children and experimental research on the effect of interactive imaginative videos on change in difficult eating behavior of in stunted and malnourished children. Also, the second, we have also CARIA, the community service involving posyandu charges in stunting screening programs and stunting health education for children. And then for our next topic, the conclusion is, the topic is actually the factors which affecting COVID-19 vaccination acceptance in general population. And the conclusion is there were 13 suitable literatures which came from various countries. Factors affecting COVID-19 vaccine acceptance were age, level, education, vaccines experience before COVID-19 knowledge, worry or fear regarding COVID-19, higher income, testing negative for COVID-19, chronic disease, gender, health profession, belief safety in vaccines, willing to pay for vaccine, race, medical personnel advice, social media use, the perception that prevalence and death rate reports of the government are real, having a close relative or friends ever infected by COVID-19. And then for our next topic is the effect of psychoeducational intervention for caregivers burnout of clients schizophrenic. The conclusion is psychoeducation intervention is effective in reducing the level of caregivers burnout client schizophrenia. Psychoeducational therapy can be applied in dealing with psychosocial problems experienced by the caregiver's client schizophrenia. And then for our last topic, the sleep quality among nursing students during COVID-19 pandemic. The conclusion is most of students' sleep quality in the study that had poor sleep quality. So it can be concluded that the COVID-19 pandemic has had a negative impact on student sleep quality. Students with a young age were also found to have used sleeping pills at least once or twice times a week. This is a condition that requires both family and professional help. Okay, everyone, that's my conclusion or the conclusion for today's oral presentation. I think this is the end of our session, and I'm going to give back the next agenda to the master of the ceremony. I'm Altania Giovanni. Thank you for your attention.
Thank you, moderator, and also all our presenters who present us a good literatures.
Terima kasih moderator dan juga semua peserta oral presentasi yang telah mempresentasikan materinya yang sangat bagus.
Well, as our appreciation to audience, we have chosen 3 lucky students from each institution in this seminar to get 100,000 rupiah credit. Congratulations to all the lucky winners. Hope it's useful.
Baiklah, tiba saatnya sebagai apresiasi kami kepada para audiens, kami telah memilih 3 orang yang beruntung dari setiap institusi dalam acara seminar ini untuk mendapatkan pulsa sebesar Rp100.000. Selamat kepada pemenang yang beruntung. Semoga bermanfaat. Nama-nama bisa dilihat dalam layar Anda masing-masing. Pelni, Ada Esti Komaria, Anissa, dan Nadila.
Kemudian ada Akper Pasarebo, Alden Japana, Bernadetta, dan Tarisa.
Akper Cikini, ada Jessica, ada Dea, dan Santi.
Dan Akper Keris Husada, Derima, Endang, dan Bella. Selamat buat semuanya. Okay, then before we end, to all participants, I kindly invite all of you to fill the link evaluation that will be distributed on Zoom chat room to get certificate.
Kepada para hadirin sekalian, sebelum mengakhiri acara, dipersilakan untuk mengisi link evaluasi yang akan disebarkan di chat room Zoom untuk mendapatkan sertifikat.
Ladies and gentlemen, that's the end of our International Nursing Conference.
Demikian acara demi acara telah kita lalui, maka berakhir sudah seminar internasional keperawatan pada kali ini.
Hopefully we can take advantage and benefit from this conference to improve our knowledge, especially how to treatment children with cancer in COVID-19 pandemic era.
Kami sungguh berharap kita semua mendapatkan ilmu yang berguna bagi perkembangan ilmu keperawatan kita di Indonesia, terutama bagaimana dalam memberikan asuhan keperawatan pada anak dengan kanker di masa pandemi COVID-19 ini.
And we would like to see you again on the next International Nursing Conference. Thank you very much and goodbye.
Terima kasih dan sampai jumpa dalam seminar internasional keperawatan berikutnya. Bye.
Thank you very much. Bye.
Jumlah pasien yang meninggal dengan berbagai macam tadi sebelum 6.000 kasus positif corona. Ini saatnya kita untuk berduka.
Tapi di balik semua itu, kamu masih tetap tegar, bangkit, dan berjuang lagi.
Cause you know I'm all about that bass, no trouble. I'm all about that bass, no trouble. I'm all about that bass, no trouble. I'm all about that bass, Cause you know I'm all about that bass, 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 about that bass. Turn the fucking bass up.
Belum selesai, mari bersama berjuang untuk Indonesia. Together we fight, together we can.